Okay, hello everyone, and welcome. Apologies for what I understand was some technical problems streaming this, which means we start a few minutes late. Sorry about that. And we'll try to make up time. We have built in a bit of time between talks, but very warm welcome to you today. I'm Rob Joyce. I'm a deputy director here at the Institute for Fiscal Studies, and it's a real pleasure to welcome you to the first of several talks today, which is part of this day of the ESRC's Festival of Social Science, which is going on this week. So I really hope that you're all, well, not least the good number of university students who normally attend today, managing to enjoy yourselves in what must be a rather unusual year at university for you, and welcome to everyone else who is here today. And I really hope that you get a lot out of all of the talks. So we're trying to really give a bit of a flavour of some of the work that we do here at the IFF and some of the issues that we tackle. And the first talk of the day is going to be on income inequality, which is actually a topic very close to certainly my heart right now, and IFS more broadly. We're currently in the middle of what is the biggest project in our history, actually, which some of you may have heard about, which is the IFS Deaton Review of Inequalities, chaired by Sir Angus Deaton, the Nobel laureate, which is a multi-year project bringing in the best people we can from all around the world to study inequalities of all different kinds, what's happening to them and what can be done about them. So this is really fits very well with what we are currently thinking about and working on in earnest. Pascal only has half an hour, so her talk will be a lot narrower than the Deaton Review. It will be focusing specifically on income inequality, what's been happening to it, and why we might care about that. So without further ado, particularly given time, I will just hand straight over to Pascal. Just remember, you can ask questions. We'll leave some time for questions at the end after the half an hour or so from Pascal. You can submit them via Slido, and you should be able to see the link to that on your screen. But Pascal, over to you.
Great, thanks, Rob. I'm just going to wait until my slides are up. Great. Okay, hi, so I'm Pascal Borquin, and I'm a research economist at the Institute for Fiscal Studies. As Rob said, today I'm going to be talking about income inequality, how and why it's changed, and why we may care. Now, as you can see from this slide, these are really not new questions, and a very wide variety of people have been thinking about these topics for millennia. And what I want to do today is basically provide you with some theoretical concepts from public economic theory and some results from empirical economic research, which hopefully will help you form your own opinions about whether inequality is something we should worry about. But first, let's quickly jump ahead a bit and look at how income inequality has changed over the last 5 decades or so. So what I'm going to show you here on the vertical axis is the Gini coefficient, and that's basically just a summary measure of broad income inequality. And you don't need to know the specifics of the Gini coefficient. It's fine if you just realize that a higher Gini coefficient means a higher level of income inequality. And what this line here shows us is that income inequality in the UK recently is considerably higher than it was in the 60s and 70s, due to a really sharp increase in the 80s. Now, if I add in the lines for other developed countries, we see that this increase is not unique to the UK, but is actually true for a large range of other developed economies, though the substantial clear rise in the 80s specifically is most profound for the US and UK. But even in Scandinavian countries, which are typically seen to be the most equal countries among developed economies, though the data is more noisy, we also see a general upward trend in inequality. Now, if we look at differences in levels rather than trends, what we see is that the UK is actually very unequal as compared to the other countries depicted here, except for the US, who is most unequal by this measure. So hopefully the previous slide has motivated you to want to know more about inequality, how it's changed, why it's changed, and why we may care. And basically my presentation is broken up into 2 parts. So in the first main part, I will focus mainly on I'll first give you an overview of the different kinds of inequalities that prevail beyond just income inequality. But after this, I'll mainly focus on income and will take an empirical approach and provide you with some stylized facts about how income inequality has changed. I'll then talk a bit about what the empirical economic research has taught us about what the causes of those economic trends are. And basically what you'll learn here is that the whole income distribution widened in the 80s, but that more recent changes have been driven by the top of the income distribution. I'll also show here that possible causes of inequality rising have very different policy implications. So in the second part, I'll then talk a bit about the impact that the coronavirus pandemic may have on inequality in the short and long term. And I'll give you some examples of how the nature of the recent shock has interacted with many old, deep inequalities. Okay, so let's jump in right to the first part. So inequality is at the forefront of the contemporary public and policy debate, perhaps even more so actually since the onset of the coronavirus pandemic, as concerns that different types of individuals have been hit to very different extents have arisen. But what do we actually mean by inequality? We may actually be interested in really a wide range of outcomes. So, for example, we might be interested in inequalities in income, a proxy for living standards, or wealth, which is important when thinking about the transmission of inequality across generations. Or we could also look at consumption, which is basically a proxy for lifetime income. But we may also want to look at other outcomes. So let me give us an example. I, for example, have chosen to work in economic research rather than, say, to work in investment banking, where likely I would earn more. But that doesn't necessarily mean that I'm worse off than someone working in such a field. So it's actually also to look at important to look at other outcomes. For example, to look at inequality in health or well-being. But actually, we might also ultimately be interested in inequalities of opportunity. So how where you're born or which family you were born into can affect inequality outcomes. And there really are very many more outcomes that we could look at. But then there's also a question of which groups we want to compare. Do we want to compare individuals or households, different kind of countries, regions, educational groups, gender, ethnic groups, and so on. So basically the point is there are many dimensions of inequalities, and I really just can't hope to cover all in one presentation. So as I mentioned a bit at the onset, I'll mainly be focusing on income inequality and particularly inequality in incomes between individuals and within a country. In the second part, I'll then show you a bit more on different outcomes. Okay, so next to that, there are also actually several different measures of income inequality which are helpful in thinking about exactly where in the income distribution overall trends in inequality are coming from. So, for example, the Gini coefficient, which I've already shown you, is broadly a summary measure that incorporates changes in inequality across the whole income distribution. In addition, we often also look at percentile ratios. So, for example, the 90-10 ratio will tell you how much higher the income at the 90th percentile is. So the income required to have an income higher than 90% of the population is than the income at the 10th percentile. So the income required to have an income higher than 10% of the population. And the reason that such measures are useful or helpful is that they're insensitive to the extremes of the distribution. So with that, I mean those at the very top and the bottom of the income distribution. And it's often really these kind of incomes that we're worried about in terms of measurement. It's often quite hard to accurately measure these incomes. On the flip side, though, we might also actually really care about the extremes. So we do also look at income shares, so for example, the top 1% share. And this measure basically tells you how much of the income overall is held by the richest 1%. So before I show you the trends in some of these measures of income inequality, let's look at what the UK income distribution looks like in a recent year. So on the horizontal axis here, we have net equivalized household income. So that's household income after taxes have been deducted and any benefits received have been added. And income is also adjusted to account for differences in household size and structure, something which we call equivalization. And here income ranges from £0 to £1,500 or more per week, where this top bar basically contains all with at least £1,500 in income per week. The vertical axis then shows you how many individuals fall in the kind of different household buckets. So on the left-hand side, we have the poorest individuals, and on the right-hand side, we have the richest individuals. So let me ask you a question. How is this distribution an equal one, or is it an unequal one? Well, it's pretty difficult to gauge from this graph, right? So this is where the inequality measures I spoke about before come into play. Another thing to note here is that this is really just a snapshot of a point in time. So perhaps actually those who we see here now at the bottom of the income distribution are not always at the bottom of the distribution. Maybe later in life they're further up the income distribution. So let's have a quick look at how we might think about inequality over the lifetime. So rather than just a snapshot, but in a kind of longer term concept. And what I'm going to do is I'm just going to present you with a very simple life cycle model. And here on the vertical axis, we have money. On the horizontal axis, we basically have time. Okay, and what this red line here shows you is how earnings will evolve over a typical lifetime. To simplify, let's just assume that individuals have basically constant salaries across different segments of their life. So you start work perhaps while you're still at university, you work part-time at a bar or as a research assistant. So you really don't earn a lot. It could also be that you're an apprentice or in a low-earning job as you just haven't accumulated kind of enough experience yet. But broadly, you're investing in your human capital. Now, in this case, we're assuming that people are smoothing their consumption over their lifetime, which means basically they have constant consumption across their lifetime as shown by the horizontal purple line. So during this first period of time circled here, in the early stage of your career, basically, you may be earning less than you want to consume, so you might actually be borrowing. Of course, in some sense, you might be borrowing from your parents, even if you never give it back, or you're just borrowing from elsewhere. Now, as we move to the middle of the chart, sorry, I'm not sure that this is, yeah, there you go. Now, as we move at the middle of the chart, as you progress in your job or leave university, and in this period you earn more than you consume, this basically means you're saving, perhaps in anticipation of the fact that you will basically want to kind of retire and want to continue to consume at a similar level at that point. So basically we have this kind of smooth pattern of consumption, but in some periods you're earning more, in some periods less, in some periods nothing. So you're either saving, borrowing, or running down your savings. So now if you look at that blue line, that shows wealth, of course you would have no wealth at the beginning, but you would begin to save as you earn more and draw down your kind of wealth upon retirement. So what's my point here? How does this help us think about inequality? Well, basically, if we just look at earnings inequality, we might not really actually care too much about the fact that students have really kind of low earnings at the start of their careers, given they may go on to earn much more later in life. So then just looking at earnings at one point of time, or more broadly income, might not be the right thing to look at. Really, we might be more interested in knowing who's going to have a kind of low earnings throughout their whole lifetime. So what I'm trying to bring across is that income inequality is important and we do care about it, but there are many other kind of inequality outcomes of inequalities that we're interested in, as demonstrated in an earlier slide. And we might not always be interested in looking at inequality in a single point in time. Nonetheless, let's continue and look at some of the measures of income inequality in more detail, but let's just keep these minds in fact. Okay. So note quickly that the stylized facts that I will talk about here refer to inequality within countries and not between countries or global inequality. And the first stylized fact I want to talk about is the one I referred to right at the beginning of this presentation, and that's that income inequality in the UK today is much higher than it was in the 1960s and 70s due to this very sharp rise that occurred in the 1980s. So this can be shown by looking at the Gini, which again I'd like to underline is just a useful descriptive measure which can be used to compare kind of broad income inequality across countries over time. And the numbers themselves are slightly less of significance. So basically I recognise that this increase here that I've circled is quite hard to get a sense of, but to give you some idea, the difference between these 2 points circled here is roughly equivalent to the difference in the Gini coefficient today in Germany and the US, two countries that really score very differently in terms of inequality in income. So this is really quite a large change. And as I showed you earlier, this increase was not unique to the UK. It was also seen in other OECD countries, but did appear to be sharpest in the US and UK. And what was really kind of unique about the 80s was that the whole income distribution widened in the 80s. So we saw the middle draw away from the bottom, but also the top drawing away from the middle. But what's happened since then is really more concerning the top of the income distribution. So if we look at the rest of the incomes in the UK, they've actually become more equal. And the only reason why we haven't seen the Gini decrease is because the top has continued to pull away. So the following picture or graph will demonstrate this, and we're going to be looking at the same period, but at two different measures of income inequality. So first I'm showing the top 1%, which again tells us what percentage of total income is held by the top 1%. And if we look at the top 1% share, it definitely increased in the 1980s, but it's also broadly continued to increase since then. Now, the second, which I'm bringing up now, is the 90-10 ratio, which captures inequality across the majority of the population. And what we see here is that the 90-10 really increased sharply in the 80s, similar to the Gini coefficient. However, since the early 90s, it's actually been kind of on a gradual downward trend. So the fact that we see these two diverging trends here really explains why the Gini, which measures income inequality overall, is broadly flat over this period. So the pulling away of the top 1% that you saw in that graph can actually be seen in a wide range of developed economies. So this can be shown by this graph, which the green squares here show the top 1% for various developed countries in 1980, while the purple one shows the top 1% using the most recent data. And we see that across the board, the top 1% share has increased, though the extent to which differs starkly across countries. So before we talk about the causes for these changes in inequality, I want to give you some idea about why we may care about inequality. So let me do this first by introducing the equity efficiency trade-off, which is a key result from public economic theory, which really relies on a particular idea about the way that inequality affects the economy. So let's go back to Boris Johnson's quote here, which really kind of hits the intuition of this concept. He said that some measure of inequality is essential for the spirit of envy, that is like greed, for a valuable spur to economic activity. So the intuition behind the equity efficiency trade-off and Boris Johnson's quote is the idea that inequality makes people work harder, as the relative gains of basically making it are higher but also that the kind of costs for falling behind are greater. So this mechanism basically implies that if inequality was lower, people would exert less effort, and as a result, the overall economy would be smaller. So this really might seem quite abstract, but there actually is quite a body of research that is consistent with this particular mechanism. For example, research from a wide range of different countries have found that when governments increase top rates of income tax, so that's a policy intervention designed to reduce inequality, that the pre-tax income of those higher earners basically fall in response, which is consistent with the notion that those with high earnings are now working less hard as the benefits of working and harder become smaller, basically. But even though there's kind of this research that supports this concept, there are two caveats that I want to highlight, which might suggest we should not put too much weight on that concept. And the first is that because the equity efficiency trade-off relies on a very particular notion of the kind of impact of inequality, it does not necessarily apply in all circumstances. So in particular, I want to emphasize that in some cases, we might actually think that inequality itself might be caused due to a market failure. For example, if product or labour markets are uncompetitive, which we consider to be a market failure, that is something that could contribute to higher inequality. And market failures are things that mean basically the economy is not operating efficiently. So if the government were able to intervene and remedy that market failure, there is scope for that intervention to both reduce the level of inequality as well as increase economic efficiency. Now, there you go. So the second caveat is a bit more straightforward, or at least I think. And that is basically that even if the equity efficiency trade-off does hold, people might just be willing to bear the cost of a smaller economy if they have strong enough preferences for greater equality. And basically, ultimately, that should be decided through political debate. So following on from that theoretical concept, I now want to talk about the potential causes for the rise in inequality I showed you earlier and demonstrate how different reasons will imply very different trade-offs given the theoretical concepts I've just laid out. So in terms of the kind of general upward trend in inequality we observe, there is a sort of high degree consensus about what is going on here. And specifically, one thing is that the idea that technological change over the last decades has increased demand for workers with certain sorts of skills more than others, and that change in demand has led to increases in earnings inequality. So the pay of higher educated workers increased, whereas that of low educated workers fell or stagnated, with the result that pay inequality has widened with knock-on consequences for income inequality. And that's a hypothesis that's been tested empirically in a range of different countries and in a range of different periods and has basically been found to hold empirically. Now, in addition, there's been a certain body of research that has looked in more developed economies about the role of increased globalization and trade and how that has affected demand for different types of workers. The increase in trade with China, for example, has replaced a lot of low-wage, kind of low-skilled jobs. And this research basically shows that trade has led to increased inequality in high-income countries, although the magnitude of the contribution, I think is fair to say, is a lot lower than the impact found for technological change. But the important thing to observe here is that we think that both technological change and trade are things that have increased the productive potential of the economy. And therefore, interventions through, say, the government that seek to reduce inequality are likely to face an equity efficiency trade-off, as I explained earlier. Now, when we're thinking about kind of what is driving the top 1% to pull away from everyone else, it's much more kind of ambiguous in the literature what is likely to be driving that. Essentially, there are various different types of hypotheses that people have brought forward and have found evidence in support of. So, for example, the idea of superstar effect, so that changes in the size of different markets mean that it's more profitable for companies now to secure very talented people to work for them. So they're willing to pay more for those most talented workers. And that's why we've seen, for example, a really substantial increase in CEO pay. Now, there's also been some interesting work in industrial organisation economics looking at market power, so a measure of market concentration and how it's changed over the last few decades. And they basically find that across a wide range of different countries and industries, market power seems to have increased. And this reduction in market competition has led to firm profits rising, particularly those of very large companies. And the reason that this might be the reason why this might have kind of led to a rise in the top 1% is that very high income people typically benefit more than average people from rises in firm profits. And that's, for example, because they're much more likely to hold stocks and shares than other people in the population. Now, the two explanations here have very kind of different policy implications. The first basically suggests that a equity efficiency trade-off may be at play, but the second kind of suggests that government intervention could increase efficiency and equity. Okay, so I'm now going to move on to the second but different part of my presentation, and here I'm going to zoom into one particular question that is especially interesting today. What impact will the coronavirus pandemic have on inequality? Now, I just want to say up front that obviously I don't actually know the answers for sure. There is a lot of ongoing work at the moment, and there will be for many years to come. So what I'm showing you today is just really very early work. And this should be seen more as an example of an application of some of the things I spoke about in the first kind of presentation, part of the presentation. Okay, so the pandemic has really kind of highlighted existing inequalities, and the nature of the shock relates to inequalities, for example, in savings and debt, housing, the state of the benefit system, and much, much more. So, for example, during lockdown, inequalities in housing quality was really made brutally clear. Furthermore, some were really or are still just better able to weather the shocks than others, given that they just had more wealth accumulated beforehand. And we've also kind of seen evidence that the pandemic, at least in the short term, has exacerbated some existing inequalities. For example, we've seen evidence of higher death rates due to COVID in more deprived areas, as well as clear kind of ethnic differences in COVID death rates. In some ways, the pandemic has also reinforced traditional gender roles, with research showing that during lockdown, mothers spent more hours per day than fathers in childcare. And finally, changes in preferences, attitudes, or technology may also have a longer-term impact on inequality. So I'll now present you with some data to back up some of these claims, and I won't cover all the points here, but I have added some resources at the end in case you're interested in more. So in many ways, the pandemic has hit low-paid workers the hardest. So low-earning individuals are more likely to work in shut-down sectors such as hospitality or non-food retail. And this is demonstrated by the chart here on the left-hand side, which shows that the lowest earning tenth of individuals on the left-hand side and the highest earning 10% of individuals on the right-hand side. And then kind of the height of the bar shows what share of each worked in sectors that were not shut down during the initial lockdown. And what we see is that while less than half of the poorest 10% of individuals work in sectors that were not kind of explicitly told to shut down, most of the richest 10% of individuals kind of work in such sectors. But not only sectors that were explicitly told by the government to shut down were affected or are still being affected, but also those who could not work from home. and that's due to the nature of their job. So, for example, if you're a constructor, I think you're going to find it pretty hard to work from home. So low-income individuals are also more likely to be unable to work from home. And combining these two facts basically just makes this gradient even starker, as shown by the graph on the right-hand side. And what it shows is that more than 70% of the individuals at the top of the earnings distribution were not in shutdown sectors and were able to work from home, while this was true for less than 20% in the bottom 10% of the earnings distribution. So what has this meant for earnings, the earnings distribution? So what it's meant is that low-income people have been more likely to see a reduction in their earnings due to lower hours or job losses. And this can be seen by this graph, where basically individuals have been lined up using their pre-crisis household income, with the poorest fifth again on the left-hand side and the richest fifth on the right-hand side. And the red line here shows us that broadly the earnings of the poorest have been hit the most. Now, if we look at household income instead of individual earnings, we see some evidence basically that the benefit system has been able to cushion falls in household incomes at the bottom, such that we haven't seen much difference in the extent to which household incomes have been hit across the income distribution, at least in the very short term. Okay, so the health impact of the pandemic has actually also disproportionately fallen on more deprived groups. So what this graph shows is the age-adjusted death rates, basically ranked by least to most deprived areas, with the least on the left and the most deprived areas on the right. And what we see by the green bars, where you basically need to look at the right axis, is that individuals in the most deprived areas are more than twice as likely to have died due to COVID-19 than those in the least deprived areas. Now, as shown by the yellow bars, where you need to look at the left axis, overall death rates are also higher in more deprived areas. However, the gradient really is less steep than for the COVID deaths. So the difference between the least and most deprived areas is much larger for COVID-19 deaths than for deaths overall. And reasons for this could be that individuals in more deprived areas are more likely to work in occupations that expose them to the virus, such as bus drivers or social care workers. They're also more likely to have comorbidities, live in cramped housing, not have outdoor space, so are dependent on public spaces for exercise and so on. COVID-19 death rates are also actually more concentrated among ethnic minorities. So Black men and women were found to be more than 4 times as likely to die from the pandemic than white men and women. Even when we control for demographics, so for example, the differences in places where people live, their self-reported health and education and so on, Black men and women are still twice as likely to die from the coronavirus than white men and women. Now, the pandemic, as I suggested at the beginning, has also in many ways exacerbated gender inequalities. So if we just look at families with children, so mothers and fathers, there are many reasons why the crisis might affect mothers and fathers differentially. So research has shown that mothers are more likely than fathers to have worked in shutdown sectors or unable to work from home. Furthermore, there are other reasons why this crisis would affect mothers and fathers differentially, in addition to what just happens to their job. If, as it happens traditionally, mothers, for example, take a disproportionate share of the additional childcare and housework responsibilities, their ability to do paid work and to keep the levels of productivity they had pre-crisis will be limited, even if their jobs remain active. And a recent study conducted at the IFS found that the recent crisis has exposed mothers more than fathers to the risk of job loss due to either their jobs being interrupted or their incapacity to combine huge increases in domestic responsibilities with the demand from paid work. And mothers are actually also more likely to have stopped working than fathers regardless, with the difference being especially stark for low educated families. They're also more likely to have been doing more childcare and housework during the pandemic than fathers, regardless of their working status. So in many ways, the pandemic may have reinforced existing gender inequalities. However, something which I'll talk a bit more about in a bit is that despite kind of doing less than mothers, fathers too are doing huge amounts of childcare. And the newly acquired role of fathers may permanently change how families and employers view paternal responsibilities and lead to long-term changes in attitudes towards gender and families in the work environment. So the last thing I want to zoom into is that school closures are also likely to have exacerbated educational inequalities. So what we see is that among those in state schools, students from poorer families are less likely to have had access to online classes, being able to talk to teachers directly through chat or video than those from richer families. And adding in kind of private schools into the mix, so the purple lines, that really makes the differences even starker. So kind of to circle this top one here, nearly 80% of those in private schools compared to 40% of those in state schools and of the poorest third of households had access to online classes. And it's also likely, of course, that richer parents would be better able to or feel more confident to help their children with their schoolwork during the lockdown. So the pandemic has the potential to undo many years of slow progress of closing the gap in educational inequalities. So I've spoken a bit about the shorter term impacts the pandemic kind of may have had on inequality. Let's quickly take a look forward and think about the risks or opportunities that the pandemic may have brought about for inequality. So as I showed you before, low earners are more likely to have seen their earnings fall due to being more likely to work in shut down sectors or unable to work from home. And the increased reliance on technology and home working may favour high income, high educated individuals at the expense of lower income, less educated individuals. Something which I haven't shown you, but that past IFS research has shown, is that younger workers are also more likely to have lost their job and experienced a reduction in earnings during the lockdown. Furthermore, those who would have entered work this year could in fact face kind of long-term scarring from the collapsing labour market, which could set back younger generations. And the fact that kind of childcare and housework has fallen far more on mothers than fathers could inhibit wage progression of mothers at a time where the progress made in closing the gender gap has kind of slowed. Children in poorer families kind of have also lost more from school closures, while higher income parents are more able to work from home, have space to educate their children and have savings for unforeseen expenditures. And this could be back really years of slow progress on social mobility. However, the crisis can also be seen as an opportunity to kind of tackle some of the most pressing longer-term inequalities. So, for example, the huge change in society could be a tipping point in kind of changing of social norms. As people have come into contact, or more people have come into contact with the welfare system, the experiences of childcare among many more men, the experiences of people working from home, or the spotlight on health, economic and educational disadvantage could actually also increase the desire for long-term, long-scale policies to address this long-standing inequalities. Okay, so I hope that what I've told you today has got you interested in inequality and has convinced you of what economics can bring to the debate. But before I end, I just want to make you aware of an existing project that is going on at the IFS, the Deaton Review, which Rob actually spoke a bit about shortly. So let me just kind of reiterate what he said. Basically, as I said, there are really many dimensions of inequality. And the Deaton Review will provide a much broader overview of the state of play than I've been able to today. It basically seeks to look much wider at how different kinds of inequality relate, which matter most, what the big forces are that combine to create them, and what the right mix is of policies is to tackle them. And so I highly recommend you to basically keep an eye on this page here for updates and new research. Okay, I think I'm running out of time, so I'm just going to click through the resources, but I think the slides will be uploaded. So thanks very much for listening, and I'll hand over to Rob now, who will chair the discussion.
thank you very much, Pascal. Yeah, we've got just a short amount of time, I'm afraid, for Q&A, partly because of the slow start. Sorry for that. I can see a question that's come in on Slido. If other people have any questions, please do get typing quickly. Perhaps I could just start, Pascal, just with one, abusing my position a little bit as chair, with one follow-up of my own that you might like to briefly talk about. You mentioned that income inequality is measured by, at least as measured by most of the normal summary statistics, actually in the UK hasn't changed that much in the last 25 years or so, even though it has, going back further, it clearly is a lot higher than it was, as is true in a lot of the developed world. I wondered whether you could briefly talk about that last 25 years or so and what's happened, just in particular, in terms of what's happened to the different sources of incomes, and the two biggest ones being, earnings in the labour market on the one hand and benefits on the other. Perhaps you could just give a brief flavour of what's actually happened there.
Sure.
Total income.
Sure.
Yeah.
So just kind of to set the scene. So of course, what I showed you was trends in income inequality, and when we try and think about what it might be driving these changes, it's good to look at, for example, trace trends in wages, in hours, and thus kind of individual earnings, and that how those then translate in kind of inequality in household income. And what we've seen is actually very kind of different patterns between women and men. So, of course, recently there's been a huge kind of increase in employment of females, and there's also been kind of a decrease of within kind of female inequality. But amongst males, there's actually been an increase in, say, inequality in wages and hours. And that's mostly been driven, I think, by kind of a decrease in hours for the low educated. So we're really seeing quite divergent trends between the two. So I think it's mainly kind of the employment growth of females that has been kind of holding that income inequality at bay.
Yeah, and then of course the other point to add on top of that is that the benefit system, when we think about going from what households are earning in the labour market, which, as Pascal said, has been sort of combination of quite different things going on for men and women. There's also the fact that the transfer system we have in the UK then is another step in order in terms of getting from earnings to total income. And so actually I think some of those figures that Pascal was showing, it's quite important to understand the role of the benefit system and the transfer system as well, particularly since around the mid-1990s. We have been increasingly topping up, for example, the earnings of a lot of those on low pay through more and more in-work tax credits, and that's been quite an important factor as well, holding down income inequality, even while some earnings inequalities have still risen somewhat over that period. Great, thank you. So we've got very little time left. There's one question on Slido. There's an excellent question actually about essentially which is a bigger problem, income inequality or wealth inequality. I mean, that's perhaps I'll just kick off on that. I mean, that's a good question for a few reasons. Perhaps I'll start with the more abstract part of the answer and then get to the more concrete. I mean, in a very sort of bog standard Econ 101 analysis, I guess, you might tend to be led to think that it's not really wealth per se that matters at all. It's usually income or perhaps even more pertinently consumption, some consumption, the resources that people have coming in, or what they're actually able to, their economic well-being from. And so you might sort of think from that very basic framework, why care about wealth, the sort of stock of wealth that people have, which is partly, going to depend on what they've chosen to save rather than spend in earlier periods, for example. But, I think probably most of us can see that actually misses potentially quite a lot about the role of wealth kind of independently, I guess, and the potential importance of that. Certainly when we start thinking about, going beyond the narrow economics and thinking about people's status and power and influence in society, which may well be an important part of what people care about in the end when it comes to inequalities. And also, the security and the ability to take risks as well, I guess. And then I guess more concretely, the answer that springs to mind is thinking right now about some of the big economic inequalities in the UK. And Pascal may well want to add to this, something she's been working on. A lot of these are wealth related, especially if we're thinking about inequalities between generations. So part of a lot of the concern that I think we rightly have right now about the economic plight of some of the younger generations is about wealth, in particular housing, and the fact that so few of them are on the housing ladder and therefore not accumulating the kind of housing wealth that some of the previous generations did, and also issues to do with the pension system and their ability to build up wealth that way as well. So I think it's a very good question. I think there's a lot of reason to worry about, or to be concerned with, wealth inequality too, which is something that Pascal didn't have as much time to cover at all. So thank you for that question. That's an important point. We are basically out of time here. Conscious that there is another session at 10 o'clock in just 5 minutes, and we are supposed to leave a little gap before that for you all to get a cup of tea, for example, and to make sure the technology is behaving itself. So I think we should leave it there. Thank you very much for watching. I hope that was interesting for you, and there are, I think, 4 more talks to come, starting with health in just a few minutes' time. So please do tune in for that. Thank you very much.
That's fine. No worries.
Okay.
Good morning and welcome to the second part of today's IFS event as part of the ESRC Festival of Social Science. My name is Ben Zaranko. I'll be chairing this lecture where I'll be joined by my colleague Lucy Craftman, who's going to talk about the economics of health inequalities, a hugely important topic and one that has arguably never been more important as we live through the coronavirus pandemic and all of its associated health impacts and disruptions across society. You can ask questions via Slido, which you should have a link to. I would encourage you to do so. We should have about 10 or 15 minutes for questions at the end. And if you don't pipe up with your own important and interesting questions, you'll be left with my own mundane offerings. So without further ado, I'll hand over to Lucy. Take it away.
So I'm going to be talking about health inequality and specifically how unequal is health in the UK. So whether you saw the previous lecture with Pascal, where she mentioned income inequality and broadly all different types of inequality, I'm going to be zooming in more specifically on health inequality. So there's 4 key topics that I hope to cover in today's lecture. The first is really just introducing what I mean by health inequality and why it may matter. Then we're going to be thinking about what could cause health inequality and then what could potentially be done to reduce it. The third topic is really trying to understand how we can disentangle what we call causation and correlation. And I'll obviously go into more detail there. But the idea is, do we think that good health leads to better income, or do we think that good income leads to better health, or is it kind of a mix, and how can we work this out? And lastly, can't give a lecture without bringing up COVID, and obviously it's very important when we're thinking about health. So I'm going to be thinking about how COVID may affect health inequalities in the UK on a couple of dimensions. So to start with, I'm going to be discussing what exactly health inequality is and why it might matter. So just to give a little taster, we could think of life expectancy as a key determinant of health. Life expectancy is often measured at birth, so the idea is when an individual is born, for how many years are they expected to live? What I'm showing here is life expectancy from the 1850s up to around the present day, and we have years on the vertical axis. And what we can see is life expectancy for both men and women has increased rapidly over this time period. In fact, it's almost doubled from around 40 years to around 80 years. We can also see that any given year, females have a slightly higher life expectancy than males, although it's slightly narrowed in the most recent years. Now, this could be the first taste of health inequality if we can think about health inequality between genders. Now, if we think about within England, health may vary by deprivation. And what we mean by deprivation is different measures of kind of prosperity or poverty within an area. So here I'm showing mortality rates of 0 to 4-year-old males in 2010. So a mortality rate here, mortality rate per 1,000, is essentially the number of deaths per 1,000 individuals in a given group. So a mortality rate of 1 would be that 1 in 1,000 0 to 4-year-old boys would die in a given group. Now on the horizontal axis, we have what's called the index of multiple deprivation, and we go from the most deprived to the least deprived. So in this sense, the most deprived are kids living in the most deprived local areas, whereas the least deprived are kids living in the least deprived or perhaps the richest local areas. And what we can see by this downward sloping line is that in the most deprived areas, we see higher mortality rates of 0 to 4-year-olds, i.e. for there's almost double the number of deaths or over double the number of deaths in the most deprived areas of 0 to 4-year-old males compared to the least deprived areas in 2010. So this is showing health inequality by deprivation. So I've introduced a couple of tasters of health inequality, but what do we actually mean by health inequality? We can consider health inequalities including health outcomes, so life expectancy would be one of those, health behaviours, or even access to healthcare between different population groups. So when we think of health outcomes, as I said, we could use life expectancy or mortality rates. We could also consider many others, such as hospitalisation rates, mental health issues, rates of chronic illness, number of disabilities, and the list can go on, some of which are easier to recognise or measure than others. Health behaviours could include nutrition, smoking, drinking, drug taking. These health behaviours can have inequalities, and they can also link to different inequalities in health outcomes. We can also think of access to healthcare. We may consider the NHS, the free healthcare system in England, to be universal healthcare for all. So we may think that access to healthcare is not potentially an issue when we think of inequality, but there still could be a difference in quality of hospitals, number of doctors per area, or information that individuals are receiving on the healthcare they can receive. So there still could be some inequalities in access to healthcare in England. So now we know a bit more about what we mean by health inequality, or health even. We might want to know who we're talking about between groups. So the most obvious might be income groups. What we mean by this is, are richer individuals healthier than their poorer neighbours? But we also might think of neighbourhoods. In this question, we're wondering, are individuals who live in certain areas healthier than other individuals living in different neighbourhoods? There are a number of other dimensions we could think of. I'll just mention a few. For example, educational groups. Are those with higher qualifications healthier? Is it directly because of their higher qualifications? There may, for example, be a channel of information. If those with higher qualifications are those who know more about healthy lifestyle behaviours, for example, then perhaps we might see this. Gender groups as well. As we mentioned right at the beginning, we see that life expectancy amongst women tends to be higher than for men overall. So do different genders suffer differently? And we'll come back to this throughout the presentation. And lastly, ethnic groups is one group I'm going to mention. We may wonder if certain groups are healthier than others, and are certain groups more vulnerable to health shocks? And we'll return to this when I discuss COVID later on. So now we hopefully have a better understanding of what health inequality is. We may wonder why exactly it matters. It can be considered simply unfair and undesirable if we know that there are a higher number of deaths, for example, in the figure I presented before, of young boys in one group than another. They may be avoidable in the sense that with intervention, maybe by, for example, building better infrastructure to reduce motor incidents, which is a very high cause of death for young individuals. So if they are potentially avoidable, people may think that they should be stopped. If they're socially determined by circumstances beyond the individual's control, again, they may be considered unfair. But for the rest of this presentation, this is not really what I'm going to discuss. This is less the role of an economist, but it's also something very important to consider. But what I'm going to be thinking about are the potential costs to society. So a term that economists often use are negative spillovers. The idea here is that a poor health or health inequality could have a direct impact on the individual who's struggling, but it could have an almost overflowing effect on other people in society. For example, it may reduce educational outcomes for individuals, which then can have a negative impact on productivity and growth. We can also consider the cost effectiveness of programs that reduce health inequality. So, for example, if a government wants to invest in a program to reduce health inequality, it may actually be what we would call cost effective. And what this means is that the benefits outweigh the costs. So, for example, this is something I'll come back to later, but if we invest in health of kids early on, it may cost a certain amount then, but they may reap rewards for years and years to come. And there may also be positive spillovers. So, for example, it may improve their education, and this could then improve productivity in the long run. And lastly, health inequality may either indicate or lead to other inequalities. So there may be underlying differences or inequalities in groups where we see health inequalities, for example, in work conditions. and therefore it may be exposing important inequalities that we want to address. Also, health inequalities can lead potentially to other inequalities, and this is something I'll come back to, but for example, we may imagine that health inequality could directly lead to some income inequality also. So now I hopefully have persuaded you that health inequality is an important issue that we might want to address. So why might governments intervene to reduce health inequality? So if you're in Pascal's lecture just before, but don't worry if you weren't, she started to discuss the idea of efficiency and equity. So what I mean by efficiency here is we may think that individuals may underinvest in their own health. So for example, if they have limited resources to buy a healthy diet, for example, they may then underinvest in their nutrition, leading to poorer health. Therefore, it may be efficient for the government to intervene and provide the resources to allow them to invest at the amount they should invest in. This amount would be to reduce the negative spillovers, as I addressed before. But there also may be an equity argument. Governments may have preference against highly unequal incomes and socioeconomic situations, so they may want to intervene to reallocate resources towards the worse off in society. Now, there's often an efficiency equity trade-off, meaning that if you invest in reducing equity, improving equity, you may end up reducing efficiency and vice versa. But throughout this discussion, I want you to think about whether that's necessarily always the case, especially when we're thinking about health and perhaps early childhood, when there's a lot of time to reap the benefits in the future. So I'm going to ask the question, is there necessarily a trade-off? So that's the first section on how unequal is health in the UK, where we've really just been introducing what health inequality is and why it may matter. Now I'm going to focus more on what might cause health inequality and what we can do to help. So there are a number of different causes, potential causes of health inequality. And again, here I'm only addressing a couple. The first could be differing deprivation in early childhood. There's been a lot of research to show that nutrition in early years can directly impact health in later years. There's a scientific discussion around the first 1,000 days from conception. So it's from the moment a child is conceived up to their second birthday. This is considered a very important window to invest in their nutrition. There's been evidence to suggest that good nutrition in these years can lead to better health in later years, and a deprivation of nutrition in these years can lead to direct negative impacts in health in later years. The other thing to consider, which I mentioned earlier, is behavioural risk factors. We may see different usage of, for example, smoking or drinking or different sleeping patterns amongst different groups, which can lead directly to different health inequalities. So, for example, if we see that some groups are smoking a lot, they may suffer then from certain health diseases that are related to this, for example, lung cancer, whereas other groups who aren't smoking do not suffer from these diseases. This then creates a health inequality between these diseases. Income is obviously a potential cause of health inequality. Income may directly impact, for example, access to healthcare or healthier environments. So we may imagine that if an individual can afford to live in an environment with low pollution levels, for example, this may have a positive impact on their health. Whereas if other individuals are living in kind of cramped or highly polluted areas, this could directly negatively impact their health. Work separate to income could also directly impact health. We could compare, for example, a manual labour worker and an office worker. Both may be faced with health risks. The manual labour worker could risk over time wearing down their body, whereas office workers may risk potential back problems from bad posture sitting down, for example. And the last point, the last cause I want to address, although this is not an exhaustive list, is the environment, which I mentioned through income before. But we could imagine that pollution levels or quality of housing can directly impact health. So here I'm just trying to give a taster of all the different things in our lives that could potentially cause different health outcomes between different individuals. So digging a little bit deeper into the first point I raised on early childhood development and the importance of health. So here I've just shown a little cycle, and we can start from the top. So here, let's imagine that a child has been deprived of nutrition in the early years. This may be purely because parents are constrained or because they have a lack of information of how important nutrition is. Now, it's been shown that this can directly hinder cognitive and non-cognitive development later on in life. This might mean, for example, if we measure their maths test scores, they do worse off on average than their counterparts who had good nutrition in early years. Now, these hindrances can directly impact and indirectly impact their economic productivity in adulthood. Directly because they actually may be lacking the cognitive and non-cognitive skills they need, but also indirectly because they may perform worse at school, receive worse grades, and therefore lack opportunities later in life compared to their counterparts who perform better in education. Now, the problem is this hindrance of economic productivity in adulthood can then create a cycle for the next generation, where if they are then constrained to provide the nutrition necessary for their children, then we are now in a kind of poverty trap that could be broken. So this is where a government could potentially intervene at one of these arrow points with policy to try and break this cycle. Now here I'm going to present an example of a government policy which is exactly trying to reduce these types of inequalities that we see. So I'm going to present now some work by some colleagues at the IFS, which focuses on what's known as Sure Start Centres. Sure Start Centres are centres that aim to improve what is known as children's school readiness. What we mean by that is the moment they arrive in school, we want them to be healthy enough, but also kind of socially and emotionally developed enough that they can start responding to the educational system and get the most out of it. But the aim also is focused on making sure they're healthy enough, and also there's some targets on the maternal well-being. So the Sure Start Centres offer families with children under the age of 5 what's known as a one-stop shop for a number of things, but importantly for today, health information and health services. So as I said, a number of colleagues from the IFS last year published some work looking at how the Sure Start Centres impact health. So they evaluate the overall impacts on health of Sure Start Centres between 1999 and the late 2000s. Now, this is a very interesting and relevant topic, as a number of these centres have closed down in recent years, and it's a political discussion whether they have been beneficial or not. So the data they look at are the location and the opening date of all Sure Start Centres, combined also with the data of children across England on a number of outcomes. So, for example, we have data on the hospitalisations of all these children, of all children, and we know whether Sure Start Centres were in the areas where the children lived or not. So I'm not going to go into too much detail on the strategy, but the idea is we can take advantage of different Sure Start Centres opening at different times to analyse the impact of the Sure Start Centre. So the idea here is you could be in a neighbourhood where a Sure Start Centre opens, and then you could have an almost identical individual living in another neighbourhood where the Sure Start Centre doesn't open. And we can compare your outcomes with that other individual who didn't have a Sure Start Centre. So that's basically the general concept, where we're comparing children in the same neighbourhood with more or less access to Sure Start Centre, accounting for the idea that there's differences between neighbourhoods and there's also differences over time. So I want to go into a little bit more detail on what exactly we're capturing here. So a Sure Start centre, as I said, may open in a neighbourhood. Now, parents with young children are allowed to go to the centre. Some do and some don't. So some parents might not go because they don't need the resources offered by a Sure Start centre. Some parents might not go because they don't have the time to travel there, or because they don't have the information of the Sure Start centres and what they offer. All parents and children in this neighbourhood would be considered what we would call treated. The idea being here is that they are offered the Sure Start centre, although not all of them are actually going to the centre. So therefore, they're not actually all engaged in the treatment. So therefore, we would call this an intention to treat. So what I mean here is every child in the area could have gone to the Sure Start centre, but we only a couple of them or a few of them will go, but we don't know which went. So when we are analysing the effects of the whole neighbourhood, we are analysing the effects of those who did go to the Sure Start centre, but also those who didn't go. So we may imagine that this could lead to an underestimation of the impact of a Sure Start centre on children who did attend, because we're also including all of those children who did not attend. But an ITT, or an intention to treat effect, often corresponds to the policy parameter of interest. So what do I mean by that? Well, what would a government really want to know? They could either know the intention to treat, which is basically, if they opened one more centre in an area, what would we expect to be the effect? Or the alternative, which would be not the intention to treat, would be, if I opened a centre in an area, what would be the effect if everyone went? But this might be an unrealistic parameter, because we know in reality not everyone will go. So this intention to treat might in fact be the policy parameter of interest. So here I'm going to show some results. And these results are on the impact of the probability of hospitalisation for injuries over the child's age 5 to 11. So on the horizontal axis, we have the age of the child, and on the vertical axis, we have the effect size. So this is not wholly important, but essentially this is the percentage difference of hospitalizations compared to baseline, so compared to before the treatment or before the opening of the Sure Start centre. And so a negative effect size would mean that we have reduced the probability of hospitalisation. So this would be a good thing. Now we've split the children into three groups. We have the richest, the middle, and the poorest. And what's most striking here is the poorest individuals have had the biggest negative effect size. So essentially the greatest impact from the Sure Start centres. And what we see is that this is not just at age 5, which is when the last age that children are allowed to go to Sure Start centres, but it continues to have an effect even to age 11. So age 11, which is 6 years after the children would have been able to go to the Sure Start centres, their reduction is around 30% of hospitalizations compared to baseline. So this is showing a huge positive, significant impact of Sure Start centres on hospitalizations for injuries of children. And this is just one example of a government intervention that can reduce health inequalities. When I say health inequalities, we may say, well, you've shown me that it reduces amongst the poorest, but that doesn't mean a reduction in inequalities. But we can see that there isn't the same reduction in the richest. Also noting that they have the lowest baseline hospitalizations, overall, this means that we're reducing the inequality between the richest and poorest on this measure of health. Seem to have lost the ability to change my slides. I think I'm back. Yes, great. So good time to pause anyway, because now we're moving on to the third topic that I wanted to discuss. So we've spoken a lot about how health and income can correlate, how we may see that individuals with good health may be more likely to have better income and vice versa. But how can we really disentangle between these directions? So to be more clear, what exactly is the problem that I'm talking about? So we might wonder if bad health, whether that's in the past, for example, in your early childhood, or in the present, could lead to a lower income. But we may also have a question of whether low income can lead to poor health. Now, why is this so difficult to work out? and what techniques can we use to try and separately analyze these two questions, i.e. the impact of health on income and income on health. So this is known as an issue potentially of reverse causality. So what is this and why might this be a problem? So here I'm introducing a very simple regression. So what I'm saying is that income of an individual I can impact health of individual I, or they can correlate. And the epsilon I here is simply an error term. Now beta here, which is in front of the income, can show the correlation between health and income. So we may expect a positive beta. Why? Well, as I've said throughout, we may expect that those with higher income may be in better health, and we may expect that those in better health may have higher income. But really, this equation is trying to estimate the impact directly of income on health. So let's take an example of life expectancy. This is a health measure that we introduced right at the beginning. Now, we may observe that those with £1,000 of higher income per year have on average 0.1 years higher life expectancy than those with £1,000 less. So if we take these numbers, £1,000 gets put into where income is, and 0.1 is the health measure. Therefore, beta is 0.1, i.e. with £1,000 more income, we see the outcome is 0.1. So we see an increase of life expectancy of 0.1 for every 1,000. So if we say income is in 1,000s, then beta would be 0.1. But this does not necessarily tell us the causal impact of income on health. We don't know necessarily that it was due to the £1,000 of extra income that we see higher life expectancy. So let's think of a causal story. So low income may lead to cramped and damp housing. This can directly lead to poor health. Now, this is a causal story where low income leads to poor health. But what about a reverse causal story? What if bad health is causing low income? Therefore, if we go back to that equation before, we may overestimate this beta, as it's both a combination of the impact income has on health, but also what health has on income. So we can think of a reverse causal story where poor health directly leads to low income because, for example, in poor health, you may reduce your ability to work and therefore earn less. Now, reverse causality is not the only issue we may see in estimating the causal relationship between income and health. There may also be something called omitted variables. What I mean by this is there's a variable that we're not including in this equation here where health equals beta income that both can impact income and health indirectly or separately. So let's take stress, for example. Stress could directly impact income, as stress may reduce your productivity in work, but stress could also directly impact health, as stress is known to be related to other health issues. Now, if we don't include stress in our estimation, we may therefore incorrectly estimate beta because it's soaking up some of the impact that stress is having on health and income. So now I've hopefully explained the issue we may have in estimating the direct impact of income on health. So here I'm going to introduce the idea of a randomized control trial, which you may have heard of both in science but also in social science. The idea of a randomized control trial is used in economic research. So let's introduce an example of what we're trying to investigate. Let's say we want to know about reducing health inequalities from different breastfeeding practices. So as I said early on, nutrition in early years might be important. So we know from research that women with higher family income are more likely to breastfeed than their counterparts with lower family income. We also know that breastfeeding may be beneficial for the mother and baby. There is UK guidance to exclusively breastfeed for around 6 months. So the research questions we may want to address are: how big of an impact does exclusive breastfeeding have on child health outcomes? And how much of this is because of the lower income? How can we be sure that the health inequalities aren't due to different factors? For example, it may be that lower income groups may have less healthy diets or more crowded housing, which can lead to less healthy children. We could do a kind of experiment. So we could randomly assign half of the pregnant women with an additional income, and we can call this the treatment group. We can then the other half don't receive any income, and they're called the control group. We could do this by, for example, hospital or antenatal care facility. So we could randomly pick some antenatal care facilities that get this income boost, and then we could randomly pick the rest that don't. Now, on average, if these pregnant women are what we call balanced, what I mean by this is that on average, before they receive the treatment, they're the same income, they have the same number of previous children, they have the same marital status, they basically on average have the same anything that might be relevant to our outcome before the treatment. Then if they are the same, the treatment and control group, then the control group is a valid counterfactual. So what we mean by that is we can compare the mean outcomes. So for example, the health of the children or the growth of the children in the treatment and control group after the child is born, after the treatment group have received this income, to have a causal impact of this pure income treatment on the health of the child. So this will allow us to directly estimate the causal impact of income on health in this specific example. However, this won't allow us to answer the question of how does income relate to health in every example, because this is a specific one, firstly for money going to pregnant women and for health of children. So there I've just tried to introduce some of the difficulties economists and other data analysts may have in trying to disentangle the relationship between health and income when doing research. And I've shown one potential method that can be used to deal with this issue. Now, for the last few minutes, I'm going to talk about how COVID can affect health inequalities in the UK. We may imagine that COVID could widen health inequalities on a number of dimensions, and I'm going to just discuss two very briefly. The first is difference impact on mental health. We may wonder if those who are already worse off in terms of depression or anxiety are struggling even more now. This is, i.e., existing inequalities being reiterated, or have the increase in mental health issues been even larger for this group that were already suffering? This would therefore be exacerbating pre-existing inequalities. The other dimension I'm going to consider, which Pascal in the previous lecture also mentioned, is a varying exposure of COVID by ethnicity. Are there differences in deaths between different ethnic minorities? And can these be explained by potential differences in demographic or geographics between these different ethnic groups? So coming to that first point, COVID and mental health. Here, I'm thinking we find that COVID has widened inequalities in mental health across gender and age groups and exacerbated pre-existing inequalities. Therefore, groups with poor mental health pre-crisis have suffered the largest deterioration in mental health. Now, these groups are young women, often are the hardest hit. So here in this figure, what we see is proportion of men and women who have claimed to have severe mental health problems. Now we look at it in three theoretical points of time. We have wave 9, which is actually a point of time in 2018, where essentially this is from survey data where individuals have responded to say if they have a severe mental health problem. And we can see that the proportion ranges between around 0 and 0.2 of the group. Now we can see the group with the highest proportion are these young women. Now, what researchers have done is they've estimated, given the in details of these individuals, what we think the rates would have been in April 2020 in absence of COVID. And we can see that things have not really changed much. If anything, the groups have kind of crowded slightly closer together. But in reality, we have the results here in the final column where COVID is labelled COVID. And what we can see is some very striking things. Firstly, there's been a huge leap in the proportion of men and women claiming to have severe problems across the board, no matter what age they are. But the biggest leap is seen in young women, which were the group who are already struggling the most. And here we can see that almost 0.4 or over a third of this group have a severe problem with mental health. Now, some other interesting findings here, for example, is one group that has really leapt up are the over 65s. And this is perhaps unsurprising, seeing as they are A, most vulnerable to COVID, and B, have had to have the most stringent lockdown as they have been shielding. And this could cause loneliness and other mental health issues. Now, this is obviously ongoing work, and this is the current state of affairs, and there'll be more research to show how this is affecting mental health over time. Now, the other dimension I wanted to consider before wrapping up is ethnicity. Now, here I'm presenting the death rate of COVID-19 amongst a number of different ethnic minorities and white British. So this would be the majority in England. And on the right-hand side, we have the population, which is denoted by these yellow dots. You'll notice that white British is not even on here because it's so much higher than 4 million. But for the other groups, just to get an idea of the size of these groups. And then the blue bars show the death rates per 100,000. So we see that by far the highest death rate is amongst Black Caribbean. And the purple horizontal line shows the average or the overall death rate. So we can see that the Black Caribbean and white Irish have a death rate that's much higher than the average. Now, we may just think that this is because of different demographic or geographical differences. So if, for example, Black Caribbean people live in an area that was highly exposed to COVID, perhaps this is why. Or there may be different demographics. So, for example, if one ethnic group are on average older, then they therefore are more vulnerable to a COVID death. So what researchers have done is they can actually adjust for this. So looking at the white British, here we have actual and adjusted measures. So what we're doing is we're adjusting all the other groups to white British. So what we're saying here is if all the other groups were would adjust their geography and demographics to be equivalent to white British, what would be their death rate? So if we standardize white British to 1, any death rate in the yellow that's above 1 means that they are dying at a higher rate, even controlling for the geography and demographics of this group. So if we go down to the Black Caribbean lines, we see that actual death rates is incredibly high. However, if we control for the geography and demographics, it does reduce a lot, but it's still over 1, which means there's almost an unexplained amount of mortality that can't be explained by their measures of geography or demographics. So this exposes some of the inequalities that we have seen during COVID, and as I said with the previous topic, more work needs to be done here to fully understand what's going on. So just to summarize, at first, I introduced what health inequality is and really showed it's a very multidimensional measure. It's broad, covering both physical and mental health, and it can be on a number of dimensions and between a number of groups. Poor health and health inequality can have negative outcomes in a number of areas, including education, work, and even other health. It's very difficult to differentiate the causal mechanisms of health inequality and the causal impacts of health inequality. But this is some of the work that researchers at IFS and other places are trying to address. And lastly, I've just given a kind of taster of how COVID is a large health and economic shock and is bound to impact health inequalities. And I've just shown this on a couple of dimensions, both mental health and between ethnic groups. So I'll leave it there so we have some time for some questions.
Great, Thank you, Lucy. Yeah, I would encourage you all to, if you have any questions, now is your chance. You can go to Slido and enter them there. We've got a couple, and I've got a few questions of my own. So we have a question, Lucy, about, I think it's in the context of the Sure Start study, about hospitalizations as a measure of child health, and really how good a measure are they? So the focus was on hospitalizations because of injury, which of course are important. Nobody wants injured children, but it's not the only thing that we care about. And did the study look at other measures of longer term child health, or is that the sort of thing, because they're longer term, we're going to have to wait to examine them in the future?
Yeah, that's a good question. So hospitalizations are quite a nice measure because they're concrete and we have them in the data. So we can definitely see if a child's gone to hospital or not. Whereas if a child's suffering from, say, stomach issues or other issues that are kind of within the home, it's much harder for us to measure. There's survey data, but this is again reported by the individuals or the parents, and therefore is bound to some kind of measurement error. So hospitalizations is quite nice as it's a bit more concrete, and injuries, in fact, are one of the leading causes of a leading kind of issues, and actually death by injury is one of the leading causes of death for these young children. So it is definitely an important one. But as you said, Ben, there are some of the things that we want to look at, perhaps we can't quite look at yet because it's a bit too early on. So I introduced some of the research, but there is a huge paper that provides other health outcomes. And also there's a lot of ongoing work looking at educational outcomes and even kind of crime outcomes. So yeah, there's a lot more work. And I think the nice thing will be putting all of these together and really understanding kind of the holistic impact of Sure Start as a whole, rather than individually on different outcomes.
Great. We have one question here, I think, about terminology, which I'm not sure I fully follow. But so, what's the correct term to use for types of government initiatives and interventions that can have a positive effect on inequalities? I mean, my guess would just be we'd call them policy interventions. And if you're a government that's looking to reduce inequalities, I would just, and it does so, I would call it a successful policy intervention. I'm not sure there's anything much beyond that. So I have a couple of further things, and in a few minutes we have left. So a lot of what you talked about, Lucy, focused on early childhood and kind of catching people in those important early years when we know that their nutrition and their development can have huge impacts on what happens to them throughout their lives. Mm-hmm. But if we wait until people get to adulthood, is it too late? Is it too late to have targeted interventions like that? Is it too late to have much of an impact?
So not necessarily. So there's obviously can be positive impacts of interventions. It depends on what measure we want to measure by when we say, is it too late? So when we think of cost effectiveness, it may be perhaps less cost effective to intervene later because, for example, there's less years to reap the benefits. And this is some ongoing research that, for example, Heckman and other researchers look at, where we may see that it's most cost effective to intervene early. But that doesn't mean it's too late, and it doesn't mean it's unimportant. So, for example, we can see high inequality in what's known as, for example, deaths of despair. And what I mean by this is deaths from suicide or drug misuse. Now, these start to creep in, not in early childhood, of course, but in kind of mid-20s and into middle age groups, especially amongst men. Now, some interventions here could be including ensuring they're not being underemployed. For example, there's been some research on that in America, and these interventions obviously happen in the labour market. So no, I don't think that intervening early on is the only hope, but it's definitely an important channel to look at.
Great. We have a question here about the paper from James Banks and Xiaowei Zhu about mental health. So I don't know how into the weeds you are with this one, Lucy, but there's a question about how the mental health variable was constructed and whether it includes a measure of severity. So I know that this is using, there's a survey called Understanding Society that go out and ask people questions every couple of years. I know they did a special COVID wave where they made a lot of effort to go out and to survey people. And I don't know whether this is I don't know if you know whether this is a count of how many different mental health problems people report having, or whether it has some measure of severity as well. I don't know if you are any more on top of that than I am.
So as far as I'm aware, it's not. It is more of a count, and it includes anxiety and depression. It's a proportion of, so the severe, when it says severe, this comes, I believe, from individuals answering the anxiety and depression kind of metrics. So they get asked a number of questions, and then if you get a score above a certain level, then it's considered severe. So in some sense, that is taking into account how severe it is, but this is kind of a binary outcome of those who have a severe versus those who don't. If that makes
So
sense.
there are internationally agreed kind of standardized measures of these things.
Exactly.
So I know there's one for depression. I think it's a Centre for Epidemiological Studies depression scale, where you get a score out of 8, and I think typically if you score 4 or more, it's judged as kind of, yes, you're depressed. Less than that, not. And there's other ones that go up to kind of 30. I don't know exactly which one was used in this case, but I guess here you'd have a cutoff point and say if you're above that cutoff, you have severe depression, anxiety, whatever. So I guess that's probably how it's done.
So this is just a proportion with the people above that cutoff. But I think in the paper they do some robustness where you can kind of vary the cutoff and make sure that these kind of results still stand.
Yes, sure. I'm sure they've tested all of that. And if I would recommend you go look at the paper directly, Brian. It's hopefully not too difficult to read, and it's super interesting, super important, and they've done it incredibly carefully and thoughtfully, and it's a really good piece of analysis. I think we'll end it there to leave a gap between this and the next session, which begins at 11, where my colleague Heidi Karjalainen will be talking about pensions and saving. I hope you're able to join for that one as well. And I hope you've enjoyed this session. You do have some positive feedback, Lucy. Someone says, thank you very much for the presentation. So helpful. So we're glad you're finding it helpful. Please do take the rest of the day. Please keep up to date with all of our work. And if you want to get a further taste of IFS research, we're still recruiting for summer students, for summer interns next summer. So if that is relevant for you, please do take a look at the information on the website. Have a great day and have a good weekend.
Thank you. Bye.
Good morning, and thank you very much for joining us. This is the latest in the IFS Public Economics lectures, and indeed part of the broader ESRC Festival of Social Sciences, of which IFS is hosting a whole load of events this week. It'd be great if people could, as well as listening carefully to Heidi's presentation, if they could also look at Slido, where questions can be filed. And then after the presentation, we'll be able to, I'll be putting those questions to Heidi, so you can dig in a bit more detail at the things that she's talking about. So without further ado, I'll hand over to Heidi, who's going to talk about issues in pensions and savings policy. Thank you.
Hi, can you?
Sorry, so we have some technical problems at the moment. We'll be handing over to Heidi in a moment. Her slide's not quite lighting up. I hope that you're all enjoying the presentation so far today. As I say, this is part of the ESRC's Festival of Social Science event. We have a set of lectures today covering different areas of public policy. These lectures were given earlier in the year at Cambridge and Oxford University, and this is an opportunity for them to be seen more broadly, to look at wider areas of public policy, and also hear more about what IFS does from day to day in our research.
Yeah.
Okay.
Great.
Heidi, over to you for your presentation. Thank you.
Thanks very much, Carl. Great. Okay. So today, as Carl mentioned, I'll be giving a presentation on pension savings and especially focusing on the UK context. So to start by an introduction, pension saving is one of the most common forms of saving among people, but it's also a form of saving where governments intervene in. So the two top sort of broader sections that I'll cover today is why do people save for retirement and why does government intervene in pension savings? And then how does the UK government specifically intervene and how has that changed over time and why has that changed over time? So first to start generally with pension savings. So why do people want to save for retirement and why do governments intervene when it comes to pension saving? And I'll start by talking about the standard life cycle model. So this is a model of saving and consumption wherein periods when people work, they receive an income. And in each period, people can choose to either save or consume. And if they consume today, they get the benefit of that today. But if they save, they can then consume later and get the benefit later. The most they can consume or save is the total of the income they receive in that period and any accumulated savings from previous periods. And so the model assumes that people are fully informed, there are no market distortions, and also it assumes perfect certainty. So people make decisions with perfect knowledge of, for example, the number of periods they live and what income they'll receive in those periods and so on. And I'll get into why that might not be a reasonable assumption in a bit, but we'll start by looking at the standard model first. So here, we're looking at an individual from the age of 22 to until the end of their life at 100. And this person starts working at the age of 22. They earn £25,000 a year, and then they know that they're going to retire at 68. So they're going to have this period of retirement from 68 to 100, where they receive no income. So why might people save for retirement according to this model? Well, they might want to smooth consumption. So in order to maintain a level of income and consumption in retirement, they'll have to save during the years when they work. So for example, if we assume that they want to maintain a constant level of consumption, in this case, it would be about £15,000 a year. They would have to accumulate wealth during the years when they're working So they would have to save while they're working, and then decumulate this wealth while they're in retirement. So this is the sort of consumption smoothing rationale for retirement saving. People are moving resources from the years in which they work to the periods when they're retired. And a particular part of pension saving, and what makes it so challenging, is that even with agents or people who have no who are fully informed, don't face any market distortions, the assumption of knowing when they will how long they will live is quite an unrealistic one. So there is usually longevity risk we can assume in this model. So people face a risk of living less or more time than they had expected. So, for example, in our example, if this person got to 100 years old and then realized they had another 100 years of life left, they would have already accumulated their wealth by that point, and they wouldn't be able to maintain the level of consumption that they previously had. So how could we solve for this? So the way in which people can protect themselves from a longevity risk is with a product called annuity. So this is a financial product that guarantees to pay a fixed income to you until the end of life. And like with any insurance product, here the sort of insurance provider takes on the longevity risk, and you essentially have to pay an insurance premium for this, which in this case means that the payouts you can expect to receive will be smaller than the amount you spend to buy this product. So just to give a sense, if this week you're 60 years old, you want to buy an annuity with a £50,000 pension pot, you could buy an annuity that would pay you £2,000 a year until you die. So that might not sound like a lot, especially if you're expecting to only live, say, 10 years after the age of 60. But if your the actual life expectancy at the moment for women age 60 is 30 years, so the insurance company would then have to, for such a person, have to pay £2,000 for a year for all of those 30 years. So with this kind of product, the people can maintain a stable level of consumption until the end of their life. So, so if people value stable consumption, they can insure away the risk of running out of income by purchasing an annuity. So these are the two key reasons why people under this model might want to save for retirement. So they save in order to smooth consumption, and they can save so that they can then insure themselves against longevity risk. So under this model, if we assume this sort of fully rational people and fully informed people, people will make optimal decisions for themselves when it comes to the trade-off of consuming and saving in each period. However, in reality, we see a lot of government intervention when it comes to pensions and pension saving. So we now turn to asking, why is that? Why can't government trust people to make the decisions for themselves about their retirement saving? So there are many reasons why people might not behave as the traditional model predicts. So we have both behavioral biases, which mean that, and we also have things like market failure, for example. But first, I'll talk about these behavioral biases. So many of you might have heard of many of these. So starting with present bias. So this means that people save too little because they're over discounting their consumption in the future, so they don't take into account the full benefit of consumption in the future. People might also think that they will start saving tomorrow, but then when tomorrow comes around, they will again prefer consuming today rather than saving. Inertia is another important one, which means that people tend to stick to whatever their default option is, especially when it comes to very sort of cognitively difficult decisions. And this is something I'll mention again when I talk about automatic enrollment. And another bias, behavioral bias, is people's kind of inaccurate assessment of risk and uncertainty when it comes to probabilities of future events. And especially in the context of pension saving, we know that people are too pessimistic about surviving past the ages of 75, 80, and 85. So they might not realize just how big a chance there is that they will need income beyond those years. So these are kind of behavioral biases. in addition to this, making decisions about pension saving is an inherently very difficult decision. So understanding all the different aspects of risk and return and being able to calculate expected returns accurately, being able to choose between different products, this is all hugely difficult. So people don't necessarily have the required level of financial literacy or knowledge of pensions. So these are all the kind of biases and distortions that might push people away from deciding to save for a pension. So government might want to intervene if they think that the right decision for people would be to save. But government might also decide to intervene because of market failure in the pension market. So in particular, in the annuities markets, as asymmetric information can lead to adverse selection and potential market failure. So as I mentioned, annuity is a product that people can buy that guarantees an income stream for them until the end of their life. So it's an insurance against longevity risk. And of course, this product is more valuable for someone if they're in very good health, if they're likely to live longer, whereas it's not worth purchasing for someone who knows that they only have a few years left. So we might end up in a situation in the annuities markets where only those with good health buy annuities. Insurance companies then end up losing money on them because they have to pay out for longer than they expected. And this can lead to the whole market collapsing or at least becoming unattractive for most people. So this is what we call adverse selection. There is also another reason why governments might want to intervene in pensions, and that's for redistributional purposes. So pensions can redistribute income between different people, both within and across generations. But this will not be the sort of full focus of this lecture, but it's also an important reason for intervening. And just before I move on, so how does the government intervene? So many countries have public pension systems. So there, the government sort of push people into saving by having a system where people pay taxes and contributions, mandatory contributions during their lifetime, and then they receive or their working life, and then they receive a pension benefit from the state in retirement. And this is what we call sort of social insurance. So the government has this structure in place so to protect people from poverty in retirement and longevity risk. Governments can also intervene. So that's the state pension side of things. Governments can also intervene by pushing people into saving privately for a pension. So in the next section, I'll sort of talk about how that's all set up in the UK. So this section talks about the UK pension system and also comparing it a bit to other countries, and then also looking at recent changes to the UK pension system. So especially I'll first start by looking at public pension systems in general. And before doing that, it's very important to think about the kind of demographic changes that are happening across the developed world in the last decade. So this chart shows life expectancy at 60 by the year when these people turn 60. So for example, this shows that the women who turned 60 in 1980 could expect to live another 23 years at that point, whereas women who turn 60 in 2020 can expect to live another 7 years longer than those who turned 60 in 1980. And we also see that this is not this trend has also has taken place over the last 40 years, and it's also projected to continue over the next 40 years. So on the next slide, I will talk about how this affects public pension systems. So a system where, as I said, people pay taxes and mandatory contributions during their lifetime and then receive a pension benefit from the state in retirement. In particular, what's important to understand here is that most public pension systems is pay as you go. That's what the PAYG here stands for. So this means that the current pensioners are paid out of current taxation, not the pension contributions that they paid in themselves. So basically, the people who are pensioners today, their pensions are paid out of taxes of workers today. So I'll talk about here. I'll talk about the demographic trends that we're seeing, what impact that has on taxes and benefits, and then what impact that has on public pension systems. So first, as you saw on the previous slide, people live longer. Obviously, that's a great thing. But the impact on taxes and benefits is that the pension payments for the government will be higher because there are more people who are living for longer. So that means that there's more money going out of the public pension system. On the other hand, the increase in life expectancy means that people tend to spend more time in retirement. So they're not necessarily increasing their work life by the same amounts as their life expectancy increased. So that means that as a portion of their life, they spend more time in retirement. That's also true at the other end of the working life. So people tend to enter the labor force later, especially because people have more degrees and so on. So people tend to these days spend a smaller proportion of their life paying taxes. So the other thing that that we also see is that fertility rates are falling. So this means that there are less people, young people who are born. So there are also less young people who in the future will be paying tax. So there are less taxpayers. And obviously these both things mean that there's less money going into the system. So this is basically what we see. The public pension systems across the world are facing these issues with sustainability because there's less money going in and more money going out. So what could a government do to adjust for this? Obviously, they could fix this by trying to balance the size of these two arrows. So firstly, the government could increase people's mandatory contributions or taxes to help pay for the bigger pension payments. This is what some governments in Europe have done. So basically having more social insurance, higher contributions, and that's the way to ensure the sustainability of the system. But it's really important to think about the trade-offs here. So when contributions are increased in this social insurance system, you do make it more sustainable because there's more money going in. And it also means that there's more redistribution, both for, especially from the younger generations to older generations. But the trade-off here is that it can lead to labor supply distortions. So this means that it can decrease the incentive to work. So when people have to pay more tax, they'll receive a lower wage for a given amount of work they've done, and they might respond by working less. And this can sort of increase the deadweight loss here, and we often call this the equity efficiency trade-off. We also have this moral hazard issue. So if people know that they're going to receive very generous state pension, they might be less likely to save privately. So this is another trade-off that governments face when they're increasing taxes. So how about the other side, the other arrow? So obviously the other way to ensure sustainability of a pension system would be to have less generous benefits. So this is another way to increase sustainability, and also this can then increase the incentive for privately saving for a pension. So it's sort of pushing the responsibility of the pension saving to the individual. And I'll now talk about the UK pension system, so we can look at the ways in which the UK system has changed in response to the changing demographics of the population. So a quick introduction to the UK pension system. It's made up of a few different components. So we have the state pension. So the government pays this amount to anyone with over 35 qualifying years, so years in work or taking care of young children, mostly things like that. And since 2016, this has been a flat rate pension. So everyone with the full number of qualifying years gets the same amount, and there's no earnings related part. It used to be earnings related, so it functioned a bit more like the sort of social insurance that I mentioned earlier, but now it's a sort of a flat rate pension. And this system is pay as you go, as I mentioned before. So the state pension is about £9,000 a year, which is about a third of median earnings in the UK. So this is not enough for most people. So traditionally, employers will also offer some sort of employer pension for employees. So it's not arranged by the state, so it's kind of a type of private pension saving, but we call it an employer pension because the employers will usually arrange it and also make some contributions on behalf of their employees. And there are two types of employer schemes. So the first one is defined benefit. So in a defined benefit scheme, as the name suggests, it sets out a formula for calculating the amount of money that an employee will receive in retirement. So it could be, for example, that for each year of service at this company, you get 1/60th of your final salary as a pension. So if you work for this company for 40 years, you're guaranteed a pension that's 2/3 of your final salary. So as this example illustrates, most of the risk with this kind of pension when it comes to your longevity and your income in retirement lies with the employer. So even if your pension contributions and the returns on those contributions don't actually cover 2/3 of your final salary until the end of your life, this is what you've been promised. So this is what the employer will have to pay you. So basically both the state pension and the defined benefit pension are in this way annuitized, because you will receive this guaranteed income until the end of your life. But another form of pension saving is defined contribution pensions. So as the name suggests, here the employee and employer agree a rate at which they contribute to this fund. And the individual can usually choose how much of their salary they put in, and also can make choices in terms of what kind of products they want to invest in. And then as the person approaches the retirement, their pension income will be determined of how much they put into the pot and how much that's accumulated returns. And then they can decide how they want to draw that wealth down. So both the sort of market risk of not knowing what happens with the investments and also the longevity risk with this type of pension lies with the employees. And of course, people might save in other ways as well, such as having a house, owning a business, having stocks or shares, and or setting up their own sort of pension fund. So that's sort of the big picture of what this UK state pension, UK pension system looks like. And I'll now talk about the changes to it in recent decades, which, you know, all of it is driven by the demographic changes that we saw at the beginning. So I'll start by talking about the state pension system and then mention also employer pensions. And so, as I already mentioned, some countries have responded to the demographic changes in their state pension systems by increasing the amount of contributions and in that way ensuring sustainability of the system, so making it more contributory. But the UK has taken a different approach to improving sustainability of the pension system by reducing the generosity of it on average. So how has the UK done that? So firstly, the government, as I mentioned already, they phased out the earnings related part of the pension. So we now have a flat rate across everyone. So it basically means that people can't make these higher contributions and then receive a higher pension. So on average, state pensions are less generous for people. In addition to that, what we've seen is an increase in the state pension age. So this is the age at which people can start receiving a state pension. So obviously one way to counter the effect of longer lives is to also make the sort of working lives longer. So I'll just show you a graph of how the women's state pension age has been increasing over time, which just illustrates that how much has happened in sort of the last decade here. So since 1940s, the state pension age was 60 for women. It was 65 for men. So in 1995, a Pensions Act was put in place that said that the state pension age of women would increase to 65 so that it would be equal to men's. But then, since then, so in 2007, in 2011, and 2014, there have been additional changes, further changes to legislation, so which all sort of bring forward the increases in state pension age and also just increase state pension age further. So this sort of shows you that there's quite a dramatic change. So a woman born in 1949 would start receiving their state pension at the age of 60. A woman born in 1961 would start receiving their state pension at the age of 67. So obviously this means that the government has to pay out the state pension for less years, so it makes it more sustainable for the government. So that's the state pension side of the picture. So we've seen this reduction of generosity there. And in other countries, the conversation often sort of focuses on state pensions, only, but in the UK context, it's also important to think about employer pensions. So they've always played an important role in the UK, and this graph sort of illustrates this point. So in the UK, the state pension has for a long time been a less significant source of pension income compared to a lot of other countries. So here we see the net replacement rates for average earners across the OECD. So that's the net income an average earner will earn from state pension compared to average earnings. So as I mentioned, this is about a third in the UK, whereas in other countries it's sort of well above that. So the employer pensions essentially in the UK also play a very important part. So what's happened to those? Well, the state pension isn't the only part of the system that's become less generous on average. So I talked about the definition between defined benefit and defined contribution schemes. So as you might know, a lot of the defined benefit schemes have come to an end for a very similar reason that the state pensions have become less generous. So they were not sustainable, especially as people's life expectancies kept on increasing. So companies were tied to paying out these pensions for much longer than they expected. So partially as a result of this, the more prevalent form of employer pensions is now defined contribution pensions. So the employers still have to pay pension contributions on behalf of their workers, but they're not liable for these future payments as they would have been under the defined benefit schemes. So what we have seen in the UK, as I've just gone through, is this transfer of risk. So previously, the market risk, the longevity risk, those lied mostly with the state. So the state guaranteed a state pension, and the employer with the defined benefit pension. Employers were taking on those risks. But that risk has now been transferred to the individual, and also the responsibility to ensuring that they have adequate income in retirement. But as I discussed in the first section, there are many biases and many reasons why people might not save optimally. So individuals aren't really necessarily the best place to make these kind of complex decisions about their retirement savings. So because the government has transferred the risk to individuals, they've then had to intervene to try and overcome these biases in pension saving and encouraging people to save privately. So I'll now talk about what has the policy responses been to this transfer of risk. So the first very well-known policy response is known as automatic enrollment. So this was introduced in 2012, and it means that every employee aged 22 to 64 earning above £10,000 a year must be automatically enrolled to a pension scheme. So this policy tackles both inertia and present bias by nudging people into saving. And what's quite remarkable is that this has been hugely successful in encouraging people to save in pension. And why is it so remarkable is that nothing has changed here apart from the default option. So previously, people had to choose to start saving into a pension. So they had to make that conscious decision of having to save into a pension. Whereas now it's the other way around. People have to opt out, so they have to make a conscious decision not to save. And the impact that we've seen of this is that I'll show you a chart here, so we can see that among private sector employees, what we see here is percentage of working age individuals who are a member of a private pension scheme. So what we can see is that among self-employed people who are not part of or subject to automatic enrollment, their private pension membership rates have been declining until 2012 and also beyond 2012. But when we compare this to private sector employees, we can see that, yes, there was a decline until 2012, but then just by changing this default option, the private pension membership rates among this group have been increasing quite dramatically. So this policy pushes people into saving into a pension. There is also another side to this. So in order to make sure that pensions is an appealing way of saving for more people, the government also responded by introducing what's called pension freedoms. So previously, most people had to buy an annuity with their pension pot. So they would be saving throughout their lives into a defined contribution pot. And then the rules of how they could actually access the money were very restrictive. So they could withdraw 25% of the pension pot, but then they'd have to buy an annuity with the rest. But now with the introduction of pension freedoms, people can also have flexible drawdown, so they can decide how they want to draw down that wealth. So just to summarize, the UK has moved from providing this public pensions as a form of sort of social insurance to reducing the generosity of state pension. And it does make the system more sustainable, but leads to a need for individuals to save more privately. So ensuring sufficient income in retirement is increasingly the responsibility of the individuals rather than the state or the employers. And the way that the government has then responded to that risk transfer is with automatic enrollment, so nudging people into saving, and also through pension freedom, so giving people more freedom with what they can do with those savings that they've been nudged into. So I'll just conclude here. Pension systems around the world are affected by changing demographics. So as I showed you, people are living longer. They're spending less of their life in work, and also fertility rates are falling. So all of that poses a challenge to pension systems around the world. The UK pension system has responded by transferring a lot of the risk of adequate income in retirement and the longevity risk to individuals. And then with this risk transfer, they have also introduced these policies that help people nudge people into the kind of decisions that they should be making. So with automatic enrollment, nudging people to accumulate wealth, and then with pension freedoms, giving people freedom to decide how they want to use their pension wealth. And just a thought to finish on, the pandemic will be the first big test for this kind of pension system that puts most of the decision making in the hands of individuals. So the UK is unique in this combination of policies of automatic enrollment and pension freedoms. And so this pandemic and the economic crisis caused by it will be a real test for how people's decisions are affected when they are given the freedom to make those decisions. So that's it for me. Thanks very much, and I'd be happy to answer any questions. I can see there are a couple on slide already.
For those watching, please do fire in more questions via the link on Slido. So we do have two questions here. They're both very, very similar in terms of what they're getting at. I mean, you made very clear that what the UK government's been doing for quite a while is moving towards a system where we're more reliant on defined contribution pensions rather than state pensions or DB pensions, and those defined contribution pensions are individually arranged. So there's one question about whether individuals can really manage those very well, and there's another question which I think is kind of related, is about, well, aren't there risks with this kind of strategy? Do we not think that that having a lot of eggs in that basket might expose us to potential problems in the private sector investment market?
Yeah, absolutely. So it's very, very much true. So where more and more of the pension saving is reliant on individuals making decisions about their defined contribution pensions. So the question of are all individuals really well equipped to manage this well is probably no. So it's definitely true that there are a lot of people who, as I said, pensions is a very difficult, complex decision for people to make. There are a lot of uncertainties. You need a lot of both financial knowledge and just sort of financial literacy and other sort of cognitive abilities to be able to make these decisions. So not everyone is well equipped to manage this. I think that's exactly the reasoning behind automatic enrollment, is that if you just make the default option sort of good enough for people, good enough for most people, then hopefully, but through that you can then nudge these people who don't necessarily have the tools to make this decision for themselves. If the default option is good enough, then then you've kind of nudged them to the right direction, even if they can't make those decisions themselves. And again, this definitely this financial system, investment risks, and losses. Yeah, this is absolutely an issue with the defined contribution schemes, and maybe something that people don't necessarily appreciate is that with this kind of pension pot, if you haven't annuitized it, you're very much subject to market fluctuation. So, for example, as a result of COVID, we saw stock markets fall by 20-30%. So obviously that means that if someone had their pension savings in that in the stock market, their pension wealth would have fallen by that amount. So that's really obviously then they would these people would have to change their plans quite dramatically if they face that kind of reduction in their pension wealth. And so this is definitely an issue, and also especially with defined contribution, there's no sort of pooling of risk. It's all with the one person, rather than with sort of a public pension system that invests people money. You could sort of redistribute between those people who retire in good times and those people who retire in bad times. So yeah, those are definitely issues that people might face.
Yeah, and certainly when you've got a bigger private pension saving arena, the government needs to have a whole load of regulation in place to ensure that as best as possible investments are done appropriately and appropriate risks are taken. So there's another question which is really about risk transfer, and you talked about how in DB schemes the risk is with the employer, in DC schemes the risk is with the individual, and how the government has been trying to get rid of a lot of the risk that it was holding previously by having a more generous state pension. And I think what the question is getting at is this risk transfer real, or might do we not see some cases where defined benefit pensions fail? Potentially, if we were to see annuity providers or defined contribution pensions fail, might we not see some of that risk go back to employers, employees, or indeed the state in ways that perhaps we didn't anticipate?
Well, I mean, yes, that's obviously that is obviously a risk, and we did see in the sort of defined benefit world cases where a company would collapse and would not be able to pay people their pensions, even though they had been promised those. Often that did have to do more with fraud and things as well, but the risk obviously does exist. Yeah, so yes, there is definitely it's not a full risk transfer of the state, but at least this sort of yes, you would hope that we wouldn't be in a situation where the government would be bailing out all of these providers, and so on. So there is still the risk has been transferred in that sense.
Yeah, and I think a lot probably comes down to whether you have got if the government's successful in getting the regulations right, it's probably going to be more successful in genuinely transferring some of the risk. Where those regulations fail, it's probably less likely to actually, the result might be that some of the risk hasn't been transferred. So there's a question about the UK state pension system, thinking about our new single tier pension that you spoke about. So people are paying contributions to accrue an entitlement to that. We don't just pay that pension to everybody. The question is about how those contributions are invested. Where does the money go when people pay their national insurance?
So this is the point that I made about the pay-as-you-go pension. So again, so it's very different from how you would view a defined contribution scheme, for example, where you put in contributions and then you watch them accrue or grow over time. But with the pay-as-you-go state pension, basically taxes that I would pay today than pay out the pensions of pensioners today. Obviously, so yeah, there's no sort of direct link between the contributions that I make and the amount that I receive in that sense.
Indeed, the money's not being invested, it's going to today's pensioners. And actually, when the UK state pension in its current form was kind of first introduced after the Second World War, Beveridge did propose a system where money would be paid in, there'd be a pot, that pot would be invested, it would be used to pay out the pensions of the people who paid the money in. And very quickly the decision was made, no, we want to make pensions payable to today's pensioners after the Second World War, and in particular to be generous to those people who'd contributed during the Second World War for understandable reasons. So we paid out pensions to people who hadn't been working that long in the system and hadn't made contributions in that financial sense. So for understandable reasons, we wanted to pay pensions out very quickly, and therefore that's how the systems continue to be since then. So I have some questions about automatic enrolment. You spoke about that being one of the key reforms. I wondered if you could talk a bit more about the power that nudge seems to have had, and perhaps contrast a bit with what's been going on for the self-employed, where I know you've done some recent work.
Sure. So as I showed you the chart of the what we've seen happen between the self-employed and the employees. So yeah, as I said, and as Carl mentioned, self-employed aren't subject to automatic enrollment. So for self-employed people, it's still very much their decision to opt in. So they have to make the conscious decision to opt into pension saving. So what we've seen there is that that really isn't happening. And if anything, the number of those self-employed people who save into a pension is falling. And yes, we've done some research on this, and actually, interestingly, we found that we can't really explain this with any obvious explanations like changes in characteristics of the self-employed or changes in their attitudes or anything. So this kind of is a puzzle in that sense. But I think the government would be quite keen to take on board some of these lessons from automatic enrollment also for the self-employed. So basically what automatic enrollment did for employees, again, as you saw in that chart that I showed, was that the pension contributions or the pension membership among employees was also falling until 2012. And the government was very worried about this. And just by changing making it more automatic and the pension saving more automatic, and changing the default option and making it an opt-out system, simply with that, so the government was able to, well, the government witnessed this really dramatic increases in the proportion of employees who save into a private pension. So that really shows the power that all you need to do is kind of change the what the default option is and what you're opting out of. Yeah.
Does this mean that then across employees, if we want them to save more, we should just be, I don't know, opting more of them in, increasing the amounts that you contribute by default? Are there any, I mean, should we just not use automatic enrollment and just turn up the dial, if you like?
Yeah, well, that's the difficulty with automatic enrollment is that it's kind of a blanket policy. So everyone, every employee earning more than £10,000 a year is opted in automatically, and basically the default rates are also all the same. So the employees are paying about 4% of their income, and they get about the same from their employer and the state. But what we do know, again from some IFS research, is that actually before automatic enrollment, people who were very financially vulnerable, so people who struggle to pay their bills, people who are in the sort of bottom decile or 20% of the income distribution, people who struggle to heat their home. For example, those people before automatic enrollments were very unlikely to be saving into a pension for good reason, because they could use the money today, or they might want to save in assets that are more liquid, so that they could access those assets while before retirement. But what we've seen after automatic enrollment is this really really striking picture where those who are financially vulnerable are no less likely to be opting out of automatic enrollment. So we're basically pushing people also at the bottom of the income distribution, or people who are really struggling to make ends meet today. We're pushing those people into saving into this illiquid assets. So no, definitely the increasing the dial for everyone isn't the answer. But again, at the top of the income distribution, maybe 4% isn't actually enough in terms of the default rates, because people at the top of the income distribution should be probably saving more so that they could have a higher income in relation to their lifetime income in retirement. So that's the difficulty with a blanket policy like this. It sort of affects everyone the same way, but there are so on average the impact is sort of positive, but then there are definitely people for whom this automatic default rate and default decision isn't necessarily the optimal one.
Right. One other question I had was about the state pension age. You spoke about how that had been increased by the government as a way of limiting the rising costs due to demographic change, in particular rising longevity. I mean, clearly that hasn't been a completely pain-free process for the government. I mean, the state pension age for women in particular has increased a lot. I wonder if you could talk a bit about what the impact that has had, and if there are any lessons learned from the last decade where that has been rising for what we might want to do going forwards.
Yeah, so as I said, the Pensions Act that was increasing women's state pension age from 60 to 65 was put in place in 1995. Now, the issue is that it only started affecting people or women in 2000 who were retiring in 2010. So there was this long lag where a lot of people didn't actually realize that their state pension age had increased. So it really, yes, when it started becoming reality for people, when their state pension ages started increasing, they realized that someone who's only a few years older was able to receive state pension age from the age of 60, and for someone just a few years younger, they would have to wait additional years. This became sort of politically a very big deal. There's been many campaigns that sort of talk about the fact that this is unfair for these women. So a lot of the issue when it comes to this is awareness. So people in 1995, the government didn't actually have a way to let every woman who was affected know that they had been affected. So they kind of trusted that the women would find out somehow, but they didn't, for example, receive a letter or anything. And actually, when again IFS research from the kind of mid around like early 2000s shows that a really significant portion of the women who were affected by the state pension age increase weren't actually aware of it. By now, by 2018-19, the knowledge has improved, but there was this really long period when these women weren't aware of what was happening to their state pension age. And they were probably making decisions about their pension savings, about their when to retire and so on, based on wrong information. So I think the key lesson for the government from that is the importance of communication, and especially in the context of changes to policy and changes to legislation. People need to be aware of this, especially when, as you saw, there was an increase of 7 years for women born 12 years apart in their state pension age. So these are really significant changes to people's lives. So the importance of communications and communicating those changes is definitely a lesson for the government from that.
Yeah, and the reason why, one of the fundamental reasons why it really matters is actually the benefit system we have in place for working age individuals in the UK, including those just below state pension age, is much less generous than the state pension system and the support that's provided to those who are pensioners, including those just above the state pension age. So it matters a lot if you're just above or just below that age. Okay, I think that's our time come to an end. I think that was a great presentation. Thank you very much, Heidi, and thank you very much to those watching and to those who provided questions. There's now a break for people to have lunch. The sessions resume at 2 p.m. this afternoon, where there's a presentation on corporate tax policy that Isaac Delestra will be giving. In addition, I'd like to encourage those of you who are interested in finding out more of our work to go to the IFS website, and those for whom it's relevant, we are advertising for summer student positions for next summer. So if you are midway through an economics degree or between an undergraduate degree and a master's degree, please do give that a look. We'd be grateful to receive your application. For those who that's not relevant, but are interested in a career in economics in other ways, again, our website is the place to look for when job opportunities do come up. So that's all from me, and thank you very much to Heidi too. Bye-bye.
Good afternoon, everyone, and welcome to this fourth IFS Public Economics lecture of the day, part of the ESRC Festival of Social Science. I'm Stuart Adam, a senior research economist at the IFS. I'm going to chair this session, introduce my colleague Isaac Delestre, who's going to talk about corporation tax, why we have it, who really pays it, why there seem to be so many big multinational companies not paying very much of it. First of all, just to remind you, he's going to talk for about half an hour, and then there'll be 10 or 15 minutes for questions. Really appreciate questions from you, so as you're listening, please type questions into Slido. If you haven't seen it, there's a link to it underneath the video you're watching on the screen. If there aren't many questions, I will ask some of my own, but it's much better if I can hear questions from you and what you want to know about. And you can also vote for each other's questions so that they will jump to the top of my list and know what most people are interested in. So that's it from me for now. I will hand over to Isaac for the talk. Isaac.
Thank you very much, Stuart. Okay, I can't actually see my slides at the moment. Oh, there we go. Okay, right. So yeah, so as Stuart said, my name's Isaac Delestre. I'm a research economist here at the Institute for Fiscal Studies, attached to the tax sector. I'm going to be talking to you a little bit today about the corporation tax, or as it's sometimes known, the corporate income tax. Talking a little bit about why we have a corporate income tax and some of the policy challenges that are associated with imposing corporation taxes. So today's lecture is going to be broadly in three parts. So we're going to start off by just talking about what a corporation tax is on quite a basic level, and what function policies sort of intend, or what function policymakers intend it to fulfill in the economy. Secondly, we're going to be talking a little bit about who bears the burden of corporation tax. Ultimately, who is worse off when a corporation tax is imposed on the economy. And lastly, we're going to be talking a little bit about the particular challenges that are associated with taxing multinational corporations. So these are corporations based over multiple different jurisdictions in lots of different countries. Why do we so often see these headlines in the media about these ostensibly very profitable companies that seem to pay so little tax? So let's start at the beginning. What is a corporation tax? Why do we have one? Okay, so on a very basic level, a corporation tax is a tax on the profits of incorporated businesses. Okay, what are incorporated businesses? An incorporated business is any business that has LTD after its name, limited liability. That's most large and medium-sized companies in the UK. The exceptions being partnerships. So there are a lot of law firms, accountancy firms, these kind of companies are structured as partnerships. They actually pay tax in a different way. They don't pay corporation tax. Also sole traders. So often one or two person companies, which are often do things like, plumbers are often sole traders. Those kind of occupations, they also don't pay corporation tax. They pay tax in a different way. So those are the kind of businesses that are paying corporation tax. What is a corporation tax actually a tax on is the next question. So I'm going to just take you through very briefly the structure of a firm, which I'm sure you'll all be very familiar with, and just think about what we're taxing when we talk about corporation tax. So obviously, as you'll all be familiar with, a firm sees revenue flow in from its sales of its products. It then sees costs flow out. Maybe in this case, we have a steel widget maker and it needs to pay for the raw steel to make its widgets. Another cost that's going to flow out of these businesses are wages. They're going to flow to the firm's workers. And then finally, once all those costs have been deducted from its revenue, we're going to get firm profits. And those profits are going to flow both back into the firm in the form of investment, maybe to buy more advanced widget making machinery for the future. And some of those profits are going to flow in the form of dividends to the shareholders or the owners of the firm. Now, one thing just to flag right at this early point of the lecture, which I want you to sort of bear in mind as we're going through, is that it's really important to understand that the owners of firms, shareholders of firms, are not exclusively the kind of Bill Gates, Jeff Bezos characters that we sometimes imagine. They are not necessarily super rich people. If you have a private pension, it is almost certainly invested in stocks and shares, and so you are indirectly a shareholder in the UK's corporate stock. So actually corporate stock is held quite widely, particularly through pension funds, and so we should not think of these people as being exclusively the super rich. So corporation tax, what are we taxing? We're taxing profits. Okay, so that's the flow of company revenue. That's the flow associated with the company that we're taxing when we talk about corporation tax. Okay, so we know what a corporation tax is. How much money does it raise? Well, in 2018-19, the UK corporation tax raised £56 billion. That's about 7% of total UK tax receipts. That's obviously not small change. £56 billion is a great deal of money. Although it's worth noting that it's quite a lot less than some of the biggest revenue-raising taxes in the UK. So the income tax, for instance, raised about 4 times as much money as the corporation tax. So it's an important tax for the UK Treasury, but it's not in the absolute top tier of the most important taxes. How has corporation tax changed over time? Okay, so in this chart, we're going to be looking at the last 50 years on the horizontal axis, and then on the vertical axis, we're going to be looking at the main rate of corporation tax. So this is the percentage of taxable profits that are taken by the government when they impose a corporation tax on a company. What we can see is that in the UK, there has been really quite a substantial decline in the rate of corporation tax over the last 50 years. It's gone from over 50% to under 20% today. And one thing to note is that that is not a trend that's isolated to the UK. If we look at the US here, the US has followed a very similar path in cutting corporation tax rates very substantially over this period. And I could show you lines here for a whole bunch of European countries that have followed a similar trend. This is a very broad international trend where we've seen a secular decline in the rates of corporation tax. Okay, so we know how rates have changed. How has revenue brought in by this tax changed over time? So again, on a horizontal axis here, we've got the last 50 years. And on our vertical axis this time, what we've got is corporation tax receipts, so the total amount of money brought in by corporation tax as a percentage of UK GDP in that year. Okay, so what does that look like? The first thing I think that we need to notice from this chart is that while corporation tax bounced around quite a lot, the amount of money it brings in has actually remained remarkably quite stable over the last 50 years, which might be quite surprising given the last chart we just saw, which showed that the rates of corporation tax have come down over this period. This is actually quite a broad trend that we see internationally, that while rates of corporation tax have come down around the world, the amount of money that those corporation taxes bring in has not fallen that substantially. It's stayed quite stable. Another thing just to notice about corporation tax is, as I mentioned, it's quite a volatile tax. It goes up and down a lot in the short run. That's because, as you might expect, during sort of the boom times, there are a lot more profits to tax in the economy, whereas during recessions, and we can have a look at the 3 last large recessions in the UK here, the corporate profits tend to be a lot lower, and so you just bring in less tax with your corporation tax. Okay, so we know what a corporation tax is, and we now know how much money it raises in broad terms. What I want to do now is just take a bit of a step back and think in broader terms about why we actually might want to tax corporate profits. Why do we have a corporation tax? So the first thing I want to impress upon you, and it's something that's I think very important in trying to understand this question, is that the entire burden of tax and of corporation tax in particular falls on people. That might sound like a really obvious thing to say, but I think when we think about corporation taxes, it's really easy to fall into the trap of imagining that we're taxing some sort of anonymous, amorphous corporate entity, and that no real people are paying the price of this tax. As with all taxes, it is ultimately people who we should think of as being worse off as a result of this tax. And so with corporations, the people associated with the corporation are the people who are ultimately going to be made worse off by the tax. So either customers are going to be worse off because they're going to face higher prices, workers are going to be worse off because they face lower wages, or owners are going to be worse off because they face lower profits and lower dividends. Now, one thing just to note while we're talking about the fact that it's people who ultimately pay tax is that it's important to realise that both wages and dividends which flow out of corporations to workers and shareholders are already subject to tax. So they're already subject to the income tax, which does raise the question as to why we also want to tax profits at the firm level. Why do we, given that we're already taxing dividends? The boring answer to that is that it's just administratively a lot simpler to tax at the entity level rather than the individual level, just because there are far fewer firms than there are people in the economy. I think the more interesting question to get at here, and the more fundamental question, is why do we actually want to tax profits in the first place? And I think one of the most important answers to that question, one of the big reasons why we want to tax profits, is that it's a way in which we can tax excess profits, or the way we can tax economic rents in the economy. Okay, so even in a perfectly competitive economy, we'd expect firms to make some profit. And we'd expect firms to make some profit because they have to compensate their investors for the risk that those investors are taking. If I'm an investor and I put my money in a company, firstly, I can't spend my money while it's tied up in that company. Secondly, my money's at some risk, because if the company goes bust, then I'm going to lose my money. I need to be compensated as an investor for the risks that I'm taking, and profits are the way in which firms do that. Those profits are distributed to the owners, to the investors in the firm, and that compensates them for the risk they're taking. Now, in a perfectly competitive economy, you'd expect those profits to be what we might call normal profits, and that's the exact amount that is required in order to incentivize investors to put their money in a company and to compensate investors. Now, of course, in the real world, we don't necessarily live in a perfectly competitive economy, as we might see in microeconomic textbooks. The world we actually live in, many companies may well be making excess profits. And this means profits above and beyond the amount that is necessarily required to incentivize investment in those firms. Now, why might we see these kind of excess profits? There's a whole raft of reasons why we might see them in various firms. One big reason is that those firms might have control over scarce resources, so oil, diamonds, that kind of thing. All those firms might have positions of monopolistic or oligopolistic market power. You might think of Google and internet search, one company completely dominating the market there. Now, what's all this got to do with corporation tax? Well, it turns out that these excess profits are an amazingly good tax base. They're an excellent thing to tax. Why is that? Well, if you talk to economists about what are the downsides of tax, why might taxing be potentially a damaging thing for the economy, they'll tell you it's because taxation can often cause distortionary behaviors to occur in the economy. So one example would be if you set the income tax really, really high, one thing you might worry about is that people might work less because suddenly it's not worth their while to do overtime or whatever it may be, because the government's taking such a big chunk of their paycheck. And so you're causing a distortionary economic behavior in the economy. Well, excess profits are a good thing to tax because they tend to not cause too much of that kind of behavioral distortion. And the reason for that is that if the government takes a chunk of these excess profits, well, the firm that's earning them isn't going to like that. But at the end of the day, it's still probably going to be making a certain amount of excess profit. And so it's still probably going to be worth that firm's while to continue undertaking the activities that it was previously undertaking. Remember, these excess profits represent profits in excess of what's required to compensate investors. So you're probably not going to see a large behavioral response, or you wouldn't expect to see a large behavioral response from these firms. And therefore, you have quite an inelastic tax base. You're not going to create too much behavioral response when you tax these excess profits. And so they're going to be quite an efficient tax base. And a relatively non-distortionary tax base if you can tax them. One thing just to raise at this point, though, before you run away with the idea that corporation tax is this perfect tax, it's worth noting that corporation tax, as it is currently conceived in the UK, doesn't exclusively target excess profits. It also does target normal profits, and that can have distortionary effects. Okay, so we've talked about what we might see the purpose of corporation tax as being in the domestic economy. The next thing I want to start to talk about, what the rest of the lecture is going to focus on, is some of the challenges that are particularly associated with corporation taxes when we start thinking about them in the international context, when we start thinking about corporation tax as a tax that exists in a highly globalized international economy. And what we're going to see is that there are two big problems, or there are two problems that we're going to explore associated with this international context and corporation taxes. One is that the extreme international mobility of investment and capital can lead a larger share of the burden of corporation tax to fall on workers rather than shareholders. And the second thing we're going to find is that where we're dealing with multinational corporations, companies based in many different jurisdictions, there are going to be lots of opportunities that are going to arise for these companies to avoid tax, and that's going to lead to all sorts of these stories that we see where companies seem to pay very little tax. Okay, so let's start by considering the first of those two questions: who bears the burden of corporation tax? Okay, so we already mentioned that all tax is ultimately paid by people, and that's a crucial thing to understand. But the question it raises is which people? If all tax is ultimately paid by people, who ultimately is bearing the burden of corporation tax? Is it going to be the workers of these firms, or is it going to be the shareholders? And answering that question is going to have relevance for all kinds of other questions. One of which would be potentially inequality. So you might, while as we already discussed, shareholders aren't necessarily the super rich. On average, you would expect them to be wealthier than workers, and so you might expect, although it's not necessarily the case, that if the tax falls predominantly on workers, that the tax may be less progressive, and it might be that that has implications for inequality. Okay, so let's use an example now to think about why it might be that in a highly international context where capital is very mobile, we might see a greater burden of the corporation tax falling on workers rather than shareholders. So in this example, what we've got is we've got two countries, the UK and the US, and there's a big pile of investment in each country. That's the little green pound signs that you can see. And in both countries, those investors, the people invested in the companies of that country, are getting the same rate of return on their investment, 3%. Completely arbitrary percentage, by the way. Okay, what we're going to find is that if a corporation tax is imposed in the UK, that's going to raise costs for UK companies, and they're going to reduce the dividends they pay out to investors. And so the rate of return that investors can get in the UK is going to go down. What's going to happen next? Well, if you're investing in the UK at this point, you're going to say, well, why am I lumping for this measly 2.5% when I could get 3% by putting my money in the United States? And so a certain number of these investors are going to shift their investment from the UK to the US. Now, investment is like anything else in the economy. It obeys the laws of supply and demand. As investment becomes more scarce in the UK, its price is going to go up. As there's increasing competition for the investment that remains, that's going to drive up the rate of return. It's going to drive it up until we reach 3%, and investors become indifferent as to whether they invest in the UK or invest in the US. Now let's step back and think about what's happened here. What has imposing the corporation tax caused to occur in the UK economy in this example? Well, investors. The first thing to realize is that investors are no worse off. Investors are still getting a 3% return internationally. So the owners of companies, the shareholders of companies, are no worse off. The workers, however, are worse off. And the reason for that is that investment in the UK has gone down. Less investment in the UK means that UK firms are not going to have the most up-to-date machinery and technology, computers, that kind of thing. And it means that the workers in UK firms aren't going to be able to fulfill their potential, their productive potential, in the same way that they are in the United States in this example. And so if UK workers have become less productive because they have less investment and less capital stock in their companies, that's also going to mean that their wages are going to go down. So what we see in this example is that 100% of the burden of the corporation tax has ended up falling on UK workers whose wages have been adversely affected by the lack of investment, and none of the burden of the tax has fallen on investors who are still getting the same returns they were before the tax was imposed. Now, 100% of the burden of the tax falling on workers is a very extreme example, and we wouldn't actually expect that to happen in reality. The reason for that is that capital actually is not perfectly mobile internationally. There are lots of reasons you can imagine why capital might not be able to move completely freely around the world. One of which is that some investments are location specific. So if you're mining diamonds in the Democratic Republic of Congo, you can't necessarily move your operation to Devon. It's not necessarily going to be feasible. A lot of the estimates that currently exist, so that it's just to note, this is an incredibly difficult thing to estimate. if we want to know how much of a corporation tax is passed on to workers. But the estimates we do have, the statistical estimates we have by econometricians, suggest that around between 1/3 to 2/3 of the burden of corporation tax is passed to workers, and that's going to vary quite a lot by country, because if you have a smaller country, a smaller open country like the UK, you'd expect a larger burden to fall on workers than in a bigger country like the US. But that's the broad ballpark of how much of the tax is passed on to workers, as suggested by current estimates. Okay, so we've talked now a little bit about what a corporation tax is. We've talked about why we might want a corporation tax, what a corporation tax might want to target. And we've talked about some of the difficulties associated with who ultimately pays a corporation tax when we're thinking about this tax in the context of a highly globalized international economy. The final thing I want to talk about now is taxing multinational corporations and the very particular challenges that are associated with that. So, where we have multinational companies, and let's say here we have the UK, Germany, and France, and we have a multinational company that is based in all three, McDonald's in this case, the fundamental problem we have here is an allocation problem. What I mean by that is that if we have a company that has operations in 3 different countries, those 3 different countries have to come to some agreement as to what share of the multinational company's profits each country gets to tax. Okay, so what share of profits is allocated to each country for the purposes of corporate tax. The way in which the international community has resolved this problem, or maybe resolved is too strong a word, but the agreement that's currently in place in international law is something known as the 1920s Compromise. And now this is an agreement brokered by the League of Nations, which is the interwar predecessor of the United Nations. And the compromise essentially, the compromise instituted a system known as the taxation at source. And this essentially dictates that profits should be taxed in the country in which they're made, which seems like a pretty simple principle. But let's have a look now in an example of how this is supposed to work. Okay, so we've got here a French car manufacturer, Renault, and we've got a UK car dealership based in the UK. These are 2 separate companies in the first example. Okay, so how's this relationship going to work? Well, Renault is going to export its cars to the UK, simple enough, and the UK car dealership is going to pay the wholesale price of those cars. Now, what we can see here is that where there are 2 separate companies, the transfer of the value of those cars is going to happen automatically. The value of the cars that Renault has made is their price. That's been transferred from the UK to France, and now the French government can tax the value of those cars as part of Renault's revenue. Okay, so that's simple enough. Now, the example becomes a little bit more complicated when we imagine the possibility that Renault also owns the car dealership in the UK. So in this case, the story is going to start in the same way. Renault France is going to export cars to Renault UK. But now in this example, it's not at all obvious why Renault UK should pay Renault France for the cars. They're the same company after all. So what the taxation at source system institute is something known as transfer payments. And the way these work is that Renault UK must make a payment to Renault France as if these were 2 separate companies. So it needs to buy. So Renault UK needs to buy the cars off Renault France, so that the money associated with the production of those cars gets transferred from the UK to France, where it can be taxed. Now, what price does Renault UK pay for the cars it buys off Renault France? Well, the price that it pays is mandated by something known as the arm's length principle, to essentially be the same price that Renault UK would pay if it were a separate company. And you can see how this might be able to be policed. Renault France is going to be selling cars maybe to independent UK car dealerships, and we need to make sure that Renault UK is paying the same kind of price for those cars as those independent dealerships are making. So essentially, we sort of artificially recreate the situation where we had 2 separate companies with a single company. But if this system works so well, if it's such an effective way of allocating multinational profits to particular countries where those profits can then be taxed, why do we see these kind of headlines in the press? Why do we see headlines about ostensibly very profitable international companies paying so little corporate tax? In order to understand that, I want to take you through an example. And I want to take you through the example of a cup of Starbucks coffee that is sold here in the UK. Okay, and the question we're going to be asking is, where is the value of this cup of coffee created? So let's imagine first that Starbucks owns a coffee farming operation in Rwanda. Those coffee beans are then exported to Starbucks Switzerland, who roast and prepare the coffee beans. Now, we can imagine that the transfers associated with the taxation at source system in this case are going to be pretty simple. Those coffee beans are going to be exported from Rwanda to Switzerland, and coffee beans are a commodity that are traded very frequently on the international market. It's easy to know what a fair price of coffee beans should be, and so it should be quite easy to set the transfer price that Starbucks Switzerland should pay to Starbucks Rwanda. Okay, what's next? So next we have the UK customer service outlets, the actual coffee shops themselves, and they're going to make a transfer to Starbucks Switzerland in return for the roasted and prepared coffee beans that they import. And we might be able to see now that it could be quite easy to find out how much profit is associated with the UK branch of Starbucks in this situation. We look at the total amount of revenue that Starbucks UK makes, and we subtract the costs, including the cost of buying coffee beans off Starbucks Switzerland. Now, that might seem simple, but it seems simple because we're missing out a crucial element. And the crucial element that we're missing out here is we're missing the intellectual property, the value of the Starbucks brand. Now, let's assume that the Starbucks brand, the intellectual property of the Starbucks brand, is held in the Netherlands. Now, Starbucks UK needs to make a payment to Starbucks Netherlands in order to obtain the right to use the Starbucks brand. That might seem fine. The real difficulty with this is in deciding how much Starbucks UK should pay Starbucks Netherlands. What is the value of the Starbucks brand? It's an incredibly difficult question to answer because the Starbucks brand isn't something that's traded on international markets like coffee beans. It's something that's really only used by Starbucks. So what we're going to see is that when we ask this question of where is value created, there's often going to be no right answer. In fact, in an economy where things like where intangible assets like international property, that's brands and patents and so on, where those things are increasingly important, we're going to find that these questions of where is value created become inherently ambiguous. And when these questions become inherently ambiguous, I don't think we should be surprised to find that companies choose an answer that minimizes their tax burden. So now let's have a look at the way in which some companies might do that. So we're going to stick with the Starbucks example. And so we've got Starbucks UK and Starbucks Netherlands. And Starbucks UK is going to make its payment for the use of intellectual property to Starbucks Netherlands. Now, what I want you to imagine here is that let's imagine that the UK is a high tax jurisdiction, that the rate of corporation tax in the UK is high. And let's imagine that the Netherlands is a low tax jurisdiction, that corporation tax there is low. What we see is that if that's the situation, Starbucks has a really big incentive to make this intellectual property payment as large as possible. Because if it does, what it's going to achieve is that it's going to add costs to its balance sheet in the UK, and therefore reduce its UK profits, reduce the amount of corporation tax it pays in the UK, and it's going to add a whole load of revenue to Starbucks Netherlands. It's going to increase its profits in the Netherlands and pay more of its tax in the Netherlands where the tax rate is lower. And this is known as profit shifting. It's a way in which multinational companies can move their profits to a jurisdiction where the tax rate is lower. This isn't the only way that that companies do this, by the way. There's a number of other ways, but this is one of the more important ways to do with intellectual property payments internationally and for other intangible assets. How have governments responded to these kind of problems, these kind of challenges that are posed by multinational corporations? Well, in the UK, we recently introduced something known as the diverted profits tax. This is essentially a higher rate of corporation tax charged on companies who are deemed to be violating the arm's length principle, so pricing those international transfers incorrectly. That might seem like a good idea. You're going to increase the risk of companies violating the rules of the system. The real problem here is that, as we've kind of seen, the problem isn't primarily that companies are violating the rules, although there will be some cases where companies are acting particularly egregiously and are violating the rules. The problem is more that the rules themselves are inherently ambiguous, and that isn't really a problem that's addressed by the diverted profits tax. So what other approaches have governments taken? Another approach is the digital services tax. Now, this is a tax introduced by the UK and well, not yet introduced, but it planned to be introduced by the UK, and which is also being pursued by a number of other European governments. This is particularly targeted at digital services firms. The reason for that is that those firms tend to rely particularly heavily on things like intellectual property, and so are particularly vulnerable to this kind of profit shifting. The solution that the digital service tax comes up with is to impose a tax on revenue rather than on profits, as the corporation tax does. The rationale behind that is that it's much harder to shift your revenue from one jurisdiction to another, much harder to do that with revenue than it is with profits. The only thing to say is that while that might be a good way to capture some additional revenues of these firms, some additional tax revenue, you're still essentially just slapping on an additional tax rather than solving the fundamental problems with the corporation tax. And I think you see that in the revenues these taxes are going to bring in. So the diverted profits tax brought in about 12 million pounds in 1819. The digital service tax is forecast to bring in about 500 million when it's introduced. But really, compared to the more than 50 billion that the corporation tax raises, that's really a drop in the ocean. And what that reflects is that these are, I think it's not unfair to say, essentially sticking plaster solutions. They don't really address the key challenge to taxation at source, and the fact that this maybe is no longer a robust method for allocating profits in a world that is so highly globalized, where it's so easy to move intangible assets from one jurisdiction to another. Okay, so I just want to finish off by coming to a few conclusions. So we talked a little bit about the purpose of a corporation tax, and we talked a little bit about the fact that it can be a good instrument for targeting, potentially a good instrument for targeting excess profits and economic rents. But what we also discussed was that when we start thinking about corporation taxes in a globalized international context, there's a very particular set of problems that we start having to confront. Firstly, we confront the problem that a much greater portion of the burden of the tax ends up getting pushed onto workers, and that in the process of that occurring, we're going to drive down investment and compromise the efficiency of the domestic economy. And secondly, we see that the increasing importance of intangible assets, like intellectual property in the international economy, means that the taxation at source principle, the idea of taxing profits where they're made, is becoming increasingly nonsensical. And it's leading to these kind of failures that we see in the press. And I think it's also leading to electorates losing some faith in the corporation tax system and feeling like it isn't fit for purpose, feeling like some companies are able to avoid paying. So that's all from me. Thank you very much for listening. I'd be really happy to take your questions.
Thanks, Isaac. That's great. We've got about 5 or 10 minutes or so for questions. So please do type your questions into Slido. As I said, much better to get questions from you than questions from me. But I'll start off with one of mine. And just, Isaac, to pick up where you left off, you explained why the current way we tax multinationals is so problematic, the difficulties of this so-called taxation at source approach. And it's not just as simple as saying, you know, these companies are doing something naughty, let's, you know, pick them up and put their feet to the fire. But then what can we do about it? What's the alternative if the current approach is inherently flawed, because there's no right answer to this question as to how much of the profits are created in each country. What could we do to make the system better?
Sure. So, I think the international community broadly recognises that this is a problem, and there are a number of things that a number of approaches that are being taken towards trying to improve the situation. So one set of measures that's being taken is being led by the OECD under the Base Erosion and Profit Shifting initiative, or for the acronym lovers amongst you, BEPS, and that's essentially looking to sort of try and tie up some of the most egregious loopholes that exist in the current system. One way of that companies can shift profits in the current system, which we didn't actually really talk about in the lecture, is that they can make loans from one country to another, and that can help them to shift their profits through the interest payments. The BEPS initiative is looking to try and limit that kind of activity. It's also looking at something called permanent establishments. So in the UK, you only pay corporation tax if you're deemed to have an establishment that's not of a well, let me just look at the exact phrase. It's preparatory or auxiliary in character. If that's the nature of your operations, then you don't need to pay corporation tax in the UK. That's been a particular problem with a lot of digital firms. So if you think of Amazon in particular, you could imagine, and it has in the past been the case, that its delivery operations have been deemed to be preparatory or auxiliary in character, and so it's meant it's paid a lot less tax. There have been efforts to try and improve these kind of definitions, so particularly these kind of digital businesses that have big logistical networks that are quite important to their profitability, face more tax in the countries where they're making sales. But again, ultimately, a lot of these measures aren't getting at the heart of the problems with taxation at source. I think if you wanted more radical solutions, things that have been proposed, so ultimately, kind of what you want to do is you want to look at the global profits of these companies, and then one idea is to look at the global profits of these companies and then reallocate them. So you could say, okay, we'll look at the global profits of Starbucks. Doesn't matter where it's shifted its profits to. We're just going to look at the profits in the aggregate, and then we're going to allocate rights to tax those profits based on some kind of formula that might take into account sales, assets, employment, all that kind of thing. And to give you an example, this is a similar approach that the United States takes with different states. So in the US, it takes total US profits of a firm, and then based on this kind of formula based on variables like sales, assets, employment, they decide how much of the firm's profits get to be taxed by each US state. So you could imagine that kind of approach might work on a more global level. The big problem, obviously, with that is that it requires really a high level of international cooperation. There are going to be winners and losers if you're going to implement that kind of system, and it's quite unlikely that the losers are going to want to go along with reforming the system.
Right, and well, almost immediately following on from that, I've had a question. Outside the political will to make it happen, how complex and difficult would the policy design be to fix this?
Yeah, so I mean, I think there are realistic proposals out there. We talked there about the allocation of profits into that. As I say, this is a system that does exist in domestically in a few countries. The US being a good example to distribute taxation rights to different internal jurisdictions. There are other plans as well in terms of something known as destination-based taxation. So that's where you allocate the right to tax not based on where profits are made, but where sales are made. So it's actually much more similar to something like a VAT. Again, you could imagine a system like that working. I don't think the main problems are technocratic issues. I think the main problems, as you say, are questions of international cooperation and political will. And I mean, not just political will, but there are certainly going to be some countries that do well out of the current system that would not do so well out of a reform system, and they're going to be less happy to go along with any kind of international reform agenda. Yeah,
and I think that's highlighted by the way you described it as saying a multinational can be making profits globally, and we need to decide how to divvy those profits up between different governments that might tax it. And we do that in one way at the moment, which countries agree to under this 1920s League of Nations compromise. But if you try to change that, anytime you change the system so that it allocates more profits to one country, it might be the UK, you would have to be allocating less profits to another country, and it's hard to get all countries to agree to a system where someone's going to be getting less profits to tax to tax there. So a question in here from Stephen, which I'll kind of add to a bit myself. So the question has been, how do you modify corporation tax to reduce the tax burden paid by workers? And let me also connect that a bit to something you were saying earlier about the purpose of corporation tax, when you were distinguishing between normal profits, which is the kind of the return that investors can reasonably expect to make in return for supplying their capital, delaying spending it, taking risk and so on, versus excess profits that can come from market power and so on. And at the moment, corporation tax kind of taxes both of those. Excess profits are a really good thing to tax, at least in a domestic context, internationally perhaps a bit more difficult, whereas the normal return is more problematic, putting off investors, maybe leading them to go overseas and taking their capital with them. So taking those two parts of the question together, so the part I'm asking is, are there things that you could do with corporation tax so that you're really taxing the excess returns without so much taxing the normal returns? And then the second question, particularly in a more international context, can we be modified so that the burden isn't paid so much by workers?
Yeah, well, I think those questions are intertwined in the sense that, I mean, it becomes quite complicated, but they're intertwined in the sense that you'd expect some of the, at least some of the burden borne by workers to be caused by accident, well, by targeting normal returns, as Stuart says, which might drive capital overseas. In terms of the second part of your question, there certainly are proposals, some of which have been implemented in other countries, in terms of trying to better target corporation tax at economic rents and excess profits rather than at the normal profits that companies need to make in order to incentivize investment. One way to do that is you essentially just say, look, every company is allowed to make a normal return, and you can tie that return to something like government debt returns, and then only profits in excess of that return will be subject to the corporation tax. And that would be probably a much better way of targeting what we really want to target with corporation tax, which are these rents and excess returns, and not targeting the normal returns, which can be highly distortionary and which can have a big effect in driving investment overseas, and then potentially having those adverse effects on wages, which we saw in the lecture.
Right, I think we've probably got time for one more question. So I want to go back to the charts you were showing right at the beginning of your presentation, where you showed that in the UK, as around the world, the headline rate of corporation tax has been steadily falling over, well, the past 30 or 40 years at least, whereas revenues in the UK, as around the world, don't seem to be falling so much, although going up and down with the economic cycle. Can you say a bit more about why, if we keep cutting the corporation tax rate, revenue isn't going down? Does that prove that actually cutting taxes is so good for the economy that it makes revenue go up?
Well, no, unfortunately, it doesn't mean that. There are two primary reasons why corporation tax receipts have remained quite stable despite rates coming down. The first of those is that profits as a share of the economy have risen over this period, and you could potentially ascribe some of that to cutting rates of corporation tax. Although I think bigger factors in terms of the UK case. One, you've got a lot of privatizations in that period that we're talking about. So there's a large part of the UK economy used to be in the public sector, moved to the private sector, and so became subject to corporation tax. You've also got the rise of big industries that have been very profitable in the UK, like the City of London in that period that we looked at. I think that the second part of the answer, though, and the answer that's maybe more applicable internationally, is that this is a period when we haven't only seen governments pursue a policy of cutting corporation tax rates, we've also seen them pursue a policy of broadening the corporation tax base. And so essentially what that means is that, when you work out, here is the slide in question. When you work out how much, what are your taxable profits for the purposes of corporation tax, you take your revenue and you deduct your costs. The costs that you're allowed to deduct from your revenue when coming up with your taxable profits, that there are fewer and fewer costs that have become eligible for deduction, and therefore, while you're being charged at a lower rate, the total amount that you're paying that rate on has increased. So the definition essentially of taxable profits has been expanded over this period, and so that's a big reason why we haven't seen revenue just fall off a cliff while rates have come down. It's that, okay, rates are lower, but we're paying them on a bigger base of profit. We've broadened the definition of profit.
Great, thanks very much, Isaac. I've seen there have been a couple more very nice questions just come in, but I'm afraid I think we're out of time for today. At least glad that we've piqued people's interests. Thanks very much, Isaac. I think our time is up. We're going to have to leave it there to leave a bit of a break before the next session. So just to remind everyone, the last of the public economics lectures for today is going to be happening at 3 o'clock. That's just under 15 minutes time, when Rebecca Stroud will be talking about sin taxes. But for now, we'll leave it there. Thanks very much for joining us.
Thanks, Stuart.
Hello everyone, and welcome to the final webinar of this IFS Public Economics Lecture Day, which is part of the ESRC's Festival of Social Sciences. So this final lecture is going to be given by IFS research economist Rebecca Stroud on how we can design taxes to discourage harmful behaviour. Rebecca's going to present for around half an hour, and then we're going to have 15 minutes for your questions. So please, throughout the lecture, if you have any questions, you can ask them using Slido. So there should be a link posted below the stream, both on our website or on YouTube. And so without further ado, Rebecca, it's over to you.
Hi, good afternoon, everybody, and thanks for that, Kate. As Kate mentioned, my name's Rebecca Stroud, and today I'm going to be talking on the topic, how can taxes be designed to discourage socially harmful behaviour? So over the course of today, I'm going to cover 5 key topics. So firstly, I'm going to talk a bit about what corrective taxes are and what their economic rationale is, before going on to tell us a bit about how economic theory tells us about how these taxes should be set. And then going on to talk about some of the challenges of doing so in practice through talking about a real world example of corrective taxation in the context of alcohol. And then going on to discuss a further rationale that is sometimes posited for corrective taxation, which is internalities. This is an idea which has particularly been discussed in recent years, before ending with a brief discussion of one concern that's often raised about corrective taxation, which is its distributional effects. So let's get stuck in. First question, what are corrective taxes and what is their economic rationale? So corrective taxes are taxes on specific goods that are designed to alter the way that individuals make their consumption decisions. In the UK, these are often implemented as excise taxes. So these are taxes we have on things such as motor fuels or tobacco and alcohol. And most recently, you also may recall in the last few years, there's been a tax introduced on soft drinks too. These taxes also raise quite a lot of money for the government, accounting for about 7% of their total tax receipts. But what I want to communicate to you guys today is that aside from the revenue they raise for government, there's a really specific economic rationale behind how we set these taxes. And it's this rationale which we should use to assess whether or not a corrective tax is well designed. So what is that rationale? Well, formally speaking, corrective taxes are designed to correct for the presence of externalities in a market. What do I mean by an externality? Well, an externality arises whenever there's a cost to a third party that an agent fails to take account of at the point of taking a decision, where that cost is outside of the market mechanism. So that could sound a bit abstract if you haven't come across that concept before. So why don't we talk through a few classic examples? So 3 of the textbook examples that are often given are things such as noise, pollution, or congestion. And just to zoom in on one of these examples, the example of a factory polluting, to show you the difference between an externality and something that's not an externality, let's think about this a bit more. So imagine that we have a factory which is giving off lots of pollution, right? This pollution might impose a cost on other people living in the local area, so the local resident. But this cost is not within the market mechanism insofar as it's not something that the factory needs to take account of when deciding how much to produce or at what prices to do so. By contrast, if there was another local factory which was bidding up the price of electricity for this factory, that would impose a cost on the factory, but that cost is within the market mechanism, so therefore wouldn't count as an externality. And one of the key ideas here is that in the presence of externalities, the price of an activity does not reflect its true cost to society. In fact, the idea behind corrective taxes is to incorporate these additional costs that aren't reflected in the price into the prices paid by consumers, such that they take account of them when they make their decisions about how much to consume. So you may say, okay, so externalities don't sound great, but why are economists concerned about them? Why is this something which we tend to think we might want to correct for? Well, the answer to that is that externalities are an example of what we call market failure, by which I mean a problem that violates one of the assumptions of the first fundamental welfare theorem, and therefore causes the economy to deliver an outcome that's not efficient. And by not efficient, all I mean is a situation in which it's possible to make someone better off without making anyone else worse off. So you can go from a situation with one sad face and one happy face to 2 happy faces. So it seems like a win-win. To understand a bit about why externalities give rise to market failure, it can be helpful to think about how individuals decide how much of a given thing to consume. And in economics, we tend to think they do this by equating their marginal benefit from consumption with their marginal cost of consumption, including the price. And what I mean by the marginal benefit or the marginal cost is just the cost or benefit associated with consuming one more unit of that given thing. And we can represent this graphically, as is shown below. So what we have here is a upward sloping private marginal cost line and a downward sloping marginal benefit line. In absence of an externality, the efficient outcome would be where these 2 points meet. This is the point which is going to maximize welfare within our society. And this is also the point where individuals are going to choose to consume left to their own devices. However, in the presence of the externality, we get a slightly different picture. The private marginal cost line no longer represents all of the costs of a given decision. Instead, we have additional costs represented by the gap between the social marginal cost line and the private marginal cost line. And this vertical gap between these two lines represents the externality. However, in the context of an externality, individuals are still going to choose to consume where the private marginal cost line intersects the marginal benefit line, weighing up all the costs and benefits to themselves, but not taking into account these additional costs imposed on other people. However, the efficient point is now where the social marginal cost line intersects with the marginal benefit line, meaning that individuals are choosing to overconsume relative to what would be efficient. And this overconsumption is represented by the deadweight loss, which shows the inefficiency at play. So you might think, okay, so I'm a bit confused. We've got externalities, but why do we need government intervention to sort this out? And actually, this is an idea which was posed by a guy called Ronald Coase. He challenged the idea that government intervention, either through something like corrective taxes or through quantity control, was needed to prevent people and companies from behaving in ways that have harmed others. In fact, he argued that if certain conditions held, the affected parties could negotiate and settle conflicts privately and to their mutual benefit. And the way he formalized this is what is now known as Coase theory. So Coase theorem states that when there are well-defined property rights and costless bargaining, negotiations between the party creating the externality and the party affected by the externality can bring about the socially optimal market quantity. This was a controversial idea at the time, with Stigler, another well-known economist working in Coase's department, declaring, how could so fine an economist make such an obvious mistake? Stigler's response to this new idea was to invite 21 of the other economists within the department to dinner and to invite Coase to try and explain his views. Over the course of dinner, he wrote that in the course of 2 hours of argument, the vote went from 20 against and 1 for Coase to 21 for Coase, remarking what an exhilarating event. But Stigler wasn't completely crazy to find this counterintuitive. In fact, Coase himself was very clear that the results would only hold under very specific circumstances. In particular, he highlighted that it was going to be important that property rights were well defined and that bargaining was costless. And Coase himself acknowledged that in many cases, these are, of course, very unrealistic assumptions. In fact, in the cases, some of the most challenging externalities facing us now, such as, for example, global warming, it's not even clear how we might go around assigning property rights, let alone that they will be well defined. Moreover, it's often true that bargaining is costly, if not from a monetary point of view, then at least from a time perspective too. Okay, so far we've kind of covered the broad rationale for why corrective taxes might be valuable for there being a problem which they might want to correct for. I'm now going to go on to discuss, if we do want to correct this problem, how can corrective taxes do this? How should we go about setting them? So Pigou has showed that the socially efficient outcome could be achieved by setting the tax equal to the marginal externality at the socially efficient quantity. And that's what this little equation here says here. The optimal tax, T star, is equal to the marginal externality, phi dash, at the socially efficient quantity, which is a function of the tax. And to understand why the tax should be set this way in order to correct the externality, it's helpful to return to our graph, looking at how people make decisions about how much to consume. So remember that when deciding how much to consume, people tend to equate their marginal benefit from consumption with their marginal cost. And that was going to be the point at which the private marginal cost line on this diagram and the marginal benefit lines cross. But in the presence of an externality, this leads to overconsumption relative to the efficient level, with people consuming at the intersection between the private marginal cost line and the marginal benefit line, rather than the social marginal cost line and the marginal benefit line. By setting the tax equal to the marginal externality, the gap between the vertical distance between the social marginal cost line and the private marginal cost, you coincide the decision that individuals will make with the efficient quantity by getting them to internalize that cost. So now, in the presence of the tax, individuals will make their decisions by equating their private marginal cost plus tax line, all the costs that they then now themselves bear, with their marginal benefit line. And if the tax is set equal to the marginal externality at the socially efficient quantity, this is going to coincide with the socially efficient point. One really important and exciting thing about corrective taxes is that unlike other taxes, they don't create inefficiency. Rather, they restore efficiency, as shown by the fact that the deadweight loss disappears. Okay, so to briefly recap on what we've covered so far. What are corrective taxes? Well, we've seen that corrective taxes are taxes levied on socially harmful activities to ensure that their price reflects the social marginal cost rather than the private marginal cost. We've also looked at how corrective taxes should be set. We've seen that the tax should be equal to the marginal externality at the efficient level, and that at this rate, the externality is internalized by the decision maker. So this all looks rather simple, but in fact, there are often many complicating factors which makes it difficult to hit this mark. And this includes things such as variation in the size of the marginal externality across consumers, or even different consumption occasions, challenges in measuring the externality, and also sometimes restricted instruments being available to the government. And we're going to talk through these challenges in the context of alcohol taxation in order to look at how they can pose a challenge for using this kind of simple benchmark theory about how we should set corrective taxes, but also to look at how empirical analysis can help us to overcome some of these challenges by informing the better design of policy. Okay, let's go. So before we get stuck into that, I first want to consider why we think that alcohol might be something we want to levy a corrective tax on in the first place. Why is it something that we think might be associated with externalities? Well, there are a number of reasons. So first off, the health costs of alcohol consumption are high, with about 5.9% of global deaths and 5.1% of the global burden of disease and injury being attributed to alcohol, as well as roughly 70% of liver cirrhosis. You might have a look at these figures and say, wow, they're startlingly high, but aren't these costs that the individual bears themselves? Why are these externalities? Because they're not really costs that seem to be imposed on other people. And whilst that might be true of some of the health consequences, in the context of the UK, where we've got a national health service, that isn't true of the health care costs, which are substantial. And that's because although in the healthcare, the National Health Service is funded through general taxation, the amount that you have to pay towards the NHS doesn't depend on the decisions you make over what to drink or how reckless you are or how you live your life. Rather, it's independent of those things. There are also other reasons to think that alcohol gives rise to externalities. It's linked to violence and crime, with almost half of all violent crime being alcohol related. Also, around a third of domestic violence occurs when the perpetrator is under the influence of alcohol, and the alcohol attributable fraction of road traffic deaths is 16.6% for men and 6.7% for women. There are, of course, other reasons we might think that alcohol is associated with externalities too. And as a picture, it can be worth 1,000 words. Rather than listing them all, I'm just going to show you a picture of Manchester city centre on New Year's Eve a few years ago. And as you can see, there's probably a lot of different evidence here of externalities associated with alcohol. Okay, so we've said that alcohol is something we probably want to levy a corrective tax on. But how, given what we've discussed about how we want to set corrective taxes, how should we go about doing so? Well, recall that the optimal Pigouvian tax is to set the tax equal to the marginal externality, which is just the same equation that I've showed you earlier. If the marginal externality generated by drinking a unit of alcohol is constant across people and consumption occasions, then we would want to set a constant per unit of ethanol tax. This is something we're going to start by assuming and thinking about how we want to set corrective taxes on alcohol in this context, but it's an assumption we're going to go on to relax shortly. So imagine that the marginal externality is constant across all people and consumption occasions, across all units of ethanol. In that case, we would want to set the tax a little like how it's drawn in this graph. So what this graph shows is the excise duty per unit of ethanol by alcoholic strength. So it's alcoholic strength along the horizontal axis and the tax along the vertical axis. At this point, you can kind of ignore the magnitude at which the tax is set, but just look at the kind of shape of the tax line. So all this is saying is that each unit of tax, no matter what drink it is, no matter what type of product it is, would be taxed equally. So yes, stronger drinks would have a higher tax on them, but only because they have more units of alcohol in them, not because they are of a particular strength or particular type. However, this is rather different from how we actually see alcohol taxes looking, as shown by this graph. So what this graph shows is the alcohol tax schedule across different types of drinks in the UK. And what you'll notice is there are two things which look a bit funny about this graph relative to the benchmark that I just laid out. So firstly, you've got three of the different schedules declining in their slope. You've got these kind of curved slopes which go down like this. And these are the taxes on wine and cider. And what generates this is the fact that these products are taxed per litre of product rather than per unit of alcohol within them. And we'll go on to discuss that bit in a bit more shortly. You'll also notice that unlike in the previous graph where I showed just a single line, there are now multiple lines. And this indicates that the tax rates are varying across different types of drinks. So each of these lines represents either beer, still wine, sparkling wine, spirits, or cider, with different tax schedules for each. So I've suggested that if the marginal externality generated by drinking a unit of alcohol is constant, then we're going to want to levy a constant per unit of ethanol tax. I've also just pointed out that there are two kind of departures from this in how we actually see alcohol being taxed. So firstly, some drinks are taxed per litre of product rather than per unit of ethanol. And I'm going to suggest that there isn't really a rationale for this, that this isn't sensible. But secondly, the tax rate also varies across types of alcohol. And I'm going to suggest that there is a potential rationale for this, and we'll go on to discuss that in a bit. But let's consider the first of these first. So currently, cider and wine are taxed per litre of product rather than per quantity of ethanol. And that's what was generated, those downward sloped lines, rather than a horizontal line on the graph we just looked at. This has the odd implication that for a given tax rate per litre of product, higher strength products face a lower per unit of alcohol tax rate than weaker ones. And just to talk you through an example of this, imagine that we've got two wine products, one at 8% strength and one at 15% strength. Both of these would be subject to a tax of 288 pence per litre. And what this would come down to is for the 8% strength wine, a tax of about 36 pence per unit of alcohol, and for 15% wine, a tax of about 19 pence per unit of alcohol. Recall that we said that we wanted to set the tax rate equal to the marginal externality. So this is only going to make sense if you think that the marginal externality associated with a unit of alcohol in weaker wine is less damaging, has less of an externality associated with it than stronger wine, which we tend not to think. So this gives rise to a key principle, which corrective taxes should be levied as directly as possible on the externality generating behaviour, in this case on the alcohol content rather than the quantity of wine. The second thing, which I said looked a bit different to how the benchmark we laid out here, is that we're seeing tax rates varying across different types of products. And And I'm going to suggest there is a reason for this, or there is at least a plausible rationale for this. And that's because we see variation in the size of the externalities associated with drinking alcohol across different types of people. In fact, there's a large amount of evidence that suggests the externalities are convex in alcohol consumption. And all I mean by that is the more you drink, the greater the external costs associated with one more drink. And this is quite intuitive. Imagine you have one beer, you're probably not going to do anything too silly. But if you have more, then it becomes more and more likely as you go on. It's also true with diseases and with accidents. So there's evidence of threshold effects with some diseases, where at low level of alcohol consumption, risks are not elevated, but the risk then increases sharply above a certain point. It's also true that higher levels of alcohol consumption create an exponential risk of accidents. So the odds of injury from 8 pints is almost 18 times greater than the odds of injury from just 1 pint. But in this context, how should we go about then setting corrective taxes? We've said that the optimal Pigouvian tax, the tax which is going to achieve the first best, is to set the tax equal to the marginal externality. But if the marginal externality varies across different people and even different consumption across a different evening within the same person, then this would mean that actually on each drink we'd want to charge a slightly different tax rate, with a lower rate on the first drink than on the fifth drink. Whilst we might think this is increasingly feasible, at least conceptually, in a world of big data, there's a whole question about whether or not it's going to be desirable, even if it would be. So let's first imagine that that's not an option. We have to set a single tax rate for all consumers. In this context, we just can't achieve the first best. There's going to be a trade-off between reducing the consumption of people who consume more than ideal, the sort of people who we think are generating a large amount of the externalities, and raising the prices faced by consumers whose behaviour actually doesn't create any external costs. In this context, Diamond showed that the second best ethanol tax would be to set the tax equal to the weighted average of the marginal externalities, which is meant to be in this little equation here, but it looks like it's not quite worked. So sorry about that. But this trade-off, which you're going to be undergoing in setting just a single tax rate that all consumers must face, is going to be vast. And the reason why it's going to be vast is highlighted in the graph that I'm going to show you now. So this graph shows the distribution in the average drinks per an adult per week. So each of the red lines here indicates 20% of the drinks consumed in a given week, and the numbers here indicate the number of people who account for these drinks. So what we see is that 3% of individuals account for 20% of all drinks consumed in an average week. That 9%, 3 plus 6, account for 40% of all the drinks, and 19% account for 60% of all the alcohol consumed in a given week. If we think that the externalities associated with alcohol consumption are largely generated by the people who consume an awful lot of alcohol, then what this graph highlights is that actually it's also a relatively small number of people generating these costs. If this is true, then we're going to really have to trade off increasing the tax rate and therefore the prices faced in order to try and target the people who are generating the externalities, with also increasing the price faced by people whose consumption isn't generating any externalities. But is there a way that we can improve upon this by actually varying the tax rates across different types of products? Well, we've discussed the fact that it's the consumption of ethanol that generates externalities. But ethanol is in fact bundled together in products with other characteristics. This includes things such as alcohol type, strength, flavour. And actually these are things that consumers have preferences over too. Insofar as consumer preferences over alcohol products and their overall ethanol demand are correlated, then actually I'm going to suggest that we can improve upon Diamond's taxation. And in order to kind of inform what sort of price products we would want to tax more heavily in order to target people who are generating high externalities associated with their consumption, we can take this question to the data. So what these graphs are looking at is what type of products do different types of drinkers usually drink. So along the horizontal axis of each of these graphs, we have the average drinks per an adult per week that are purchased. So on the left-hand side of each of these graphs, we're going to have light drinkers, and on the right-hand side, we're going to have relatively heavy drinkers. On the vertical axis, in the first graph, we've got price, and in the second, we've got alcoholic strength. So looking at these graphs, we can see pretty clearly that heavy drinkers tend to drink cheap, strong alcohol. And this provides some suggestion as to the sort of products we might want to tax more heavily or target with the higher taxes if we're going to allow the tax rate to vary across different types of products. And that's going to be the cheap and stronger alcohol. But there's also going to be a further important component before we can say what the ideal way to set taxes is going to be. And that is also thinking about how people might respond to the taxes. So whether a tax succeeds in reducing alcohol consumption depends on how much of a reduction in total ethanol consumption it encourages. So what this graph shows here is the price elasticity of demand for ethanol on the vertical axis, and along the horizontal axis, again, we've got the units of alcohol consumed per an adult per week. So we've got those heavy drinkers on the right-hand side and those light drinkers on the left-hand side. And by price elasticity of demand, all I mean here is if you increase the price a little bit, how much do people change their demand for alcohol? And what we see pretty clearly in this graph is that relatively light drinkers are pretty responsive to an increase in the price. They're likely to kind of reduce their alcohol consumption quite a fair bit. By contrast, heavy drinkers are much less responsive. And actually what we see when we kind of dig into it is that heavy drinkers are very willing to switch between a given alcohol product for another if the price increases, but they're a lot less willing to switch completely out of the alcohol consumption at all. And this highlights the challenge at designing taxes to target this group in particular. Insofar as you tax the products which they're likely to particularly consume, they're going to be willing to switch to other products instead. This doesn't, however, mean that we can't use this analysis to better inform the design of policy. In fact, in their article, Tax Design in the Alcohol Market, three of my colleagues, Griffith, O'Connell and Smith, who's actually chairing today's event, characterise the optimal corrective taxes in the alcohol market and compare it to the current UK system. And in particular, they find that there is scope for significant welfare gains from three minor alterations to the current alcohol system. So firstly, levying taxes on ethanol rather than on volume. So that's kind of the first eccentricity that we discussed in respect to the current tax system. Secondly, increasing the tax rate on cider. And thirdly, reducing the tax rate on spirits, which are relatively weak, and increasing the rate of tax on spirits, which are relatively strong. And that information is just summarised in these two pictures here. So on the left-hand side, I've got the current UK tax schedules on alcohol, which I showed you already. And on the right-hand side, we've got the optimal UK system that they characterise in their paper. Okay, so that takes us on to our fourth topic, which is a potential further rationale for corrective taxes and internality. So what is an internality? Well, in the same way that an externality arises whenever there is a cost to another person that an agent fails to take account of at the point of taking their decision, an internality arises whenever there's a cost to oneself that an agent fails to take account of at the point of taking that decision. And actually, this is something we probably come across most days. So imagine yourself choosing between an apple and a cake for a snack. You may well take a whole host of factors into account for making that decision. Perhaps you consider how yummy it is, or you consider how healthy it is, but you're unlikely to fully contemplate whether all of its knock-on effects. So, for example, whether it might make you feel lethargic later in the day, or whether or not it might help you to grow big and strong as you grow up. In fact, internalities are one of the rationales that are increasingly given for interventions to improve public health. For example, soda taxes. And the idea here is that eating a poor diet imposes large future costs on individuals, and this includes things such as reduced productivity, worse health, or higher mortality. And while some of these costs are borne by society, for example, public health costs, and therefore fall more naturally into the externalities category, many of these are borne by the individual, and increasingly there's evidence that people might not take these costs fully into account. And failure to take costs to oneself into an account could arise if people are not fully informed about their health consequences, for example, or if they suffer from self-control problems, to name just 2 reasons why they might occur. And if you're interested in exploring this idea a bit further, there's a very interesting paper by O'Donoghue and Rabin, which couches this in the context of time inconsistent preferences and self-control. And just to provide a bit of anecdotal evidence that actually self-control problems might be something that we experience in our regular lives, this graph shows the Google search intensity for the word diet over the period January 2013 to January 2017. And what you're seeing is that every year in January, there's a big spike in interest in looking at the word diet. But as the year progresses and people kind of lose interest with the concept of dieting, the search intensity declines hugely. And this is at least suggestive that maybe people have these big, bold ideas that they want to stick to in January, but actually as the year comes around, they struggle a bit more to stick to this as it goes on. So hints at least self-control problems. Okay, so if we think internalities is something that we might want to correct for, how can we use corrective taxes to do so? Well, this is an exactly analogous case to what we saw with externalities. Here, in the context of internalities, we think individuals make their decisions about how much of something to consume by equating their perceived marginal cost with their marginal benefit. Perceived marginal cost being importantly indicating that there might be some cost which they're not perceiving, they're not fully taking into account. The internality is then the gap between the perceived marginal cost and the actual marginal cost, with the efficient point being where the actual marginal cost line intersects the marginal benefit, but the point where they're consuming being the perceived marginal cost and marginal benefit intersection. So again, we see this overconsumption in the context of a negative internality, and this inefficiency represented by the deadweight lost. And the optimal corrective tax in this case is just going to be to set the tax equal to the marginal internality at the socially efficient quantity. So it's the same concept as setting it equal to the marginal externality, but it's just the marginal internality now. And that's still going to be the vertical distance between the perceived marginal cost line and the actual marginal cost line. And again, when you set the tax at this rate, the efficiency is restored as the deadweight loss will disappear. So a thing that arises out of this discussion is, do internalities provide a justification for government intervention? And in fact, there are 2 polar views on this. So the libertarian view would hold that actually individual failures don't really exist, and that any kind of expression of these is just the government wanting to impose its own preferences against individual will. By contrast, the behavioural economics view will posit that individual failures do exist, that self-control problems and cognitive limitations are real aspects of our life, and that policy can actually help us to make the decisions that we would want to make optimally. And at least in theory, we should be able to distinguish between these views by, for example, asking questions like, do smokers support taxes on cigarettes? For example, if you think that it's a self-control challenge, but actually thinking about your long-term self, you would quite like not to smoke, then you might well expect smokers to support such taxes or any kind of mechanisms which will help to reduce their smoking. Either way, we may at least find the individual failures argument a bit more convincing when considering children. In fact, it does certainly seem plausible that children exhibit greater self-control problems or cognitive limitations than adults. And this is one of the rationales that's given for targeting the soft drinks levy, the tax on sugary soft drinks, specifically at soft drinks, because these are products which are consumed disproportionately by children and children with a really high sugar diet. It therefore seems like a particularly good way at targeting their consumption whilst minimising costs imposed on adult consumption or consumption by those who you might think have smaller internalities. And that brings us on to our fifth and final section of this talk, which is thinking a bit about the concerns about the distributional consequences of corrective taxation. So a common objection to the use of excise duties as corrective taxes is that they're regressive. And by regressive, all I mean is that they take a greater percentage of tax revenue from those on low income. And we can examine this kind of in data and really look at the patterns that we observe. And that's what this graph shows. So what this graph looks at is the percentage of households' income that they spend on motor fuel taxes, alcohol taxes, and tobacco taxes by income deciles. So on the left-hand side of the graph, we've got the households who have the lowest income, and on the right-hand side, we've got the wealthiest households. And what we do see is that, at least on this picture, these taxes all do look regressive. It looks like the poorest households in our society are spending a larger portion of their income on these goods. However, looking at the portion of income spent on these goods might not paint the most accurate picture. In fact, some consumers with low levels of current income may have access to other resources. For example, accumulated wealth in the past or borrowing in anticipation of high future income. So ideally, what we actually want to know is the fraction of consumers' total lifetime income that they spend on each good. But this is an object which is quite hard to find. So instead, we tend to think that looking at total spending rather than income might be a better proxy for lifetime income. And this graph kind of tries to get at that object instead. It shows the percentage of households' budget that they spend on each of these different taxes by their total expenditure decile group. So on the left-hand side, you've got the households with the lowest total household expenditure, and on the right-hand side with the highest household expenditure. And here we see that whilst tobacco duties are still regressive, other taxes such as motor fuel and alcohol taxes seem to fall more heavily on middle income earners. So the picture seems to look a little different on this scale. But an important point to note is that ultimately what matters for meeting the distributive goals is the distributional impact of the tax and benefit system as a whole, not the progressivity or regressivity of any single tax. We've seen that excise taxes are an effective way of tackling externalities, and that's because they alter the relative prices that consumers face. Instead, it might be a better idea to keep corrective taxes so that they can play this important role, whilst allowing policymakers to offset the regressivity of corrective taxes through adjustments to other elements of the tax and benefit system. This does not mean that it's not important to understand the distributional effects of corrective taxes, nor that we shouldn't bother with them. In fact, if anything, it means that understanding the distributional impacts of excise taxes is really, really important, insofar as it's necessary to determine how we can offset the distributional effects of excise tax reform that would on their own be regressive. Okay, so to quickly wrap up, we've seen that corrective taxes are effective instruments for correcting for the presence of externalities or internalities in a market. We've also seen that implementing them often involves overcoming complicating factors, and this includes things like poor measurement of external costs, variation in the marginal externality of consumption across individuals, as well as concerns about the distributional effects of these taxes. But what I hope that you take away from today's lecture is that we can use economic theory and empirical analysis to tackle these issues and to help guide better tax design.
Fantastic. Thank you very much, Becca. That was really interesting. So we now have time for a few questions. So thank you for those of you who've already posted questions on Slido. If you have more questions, feel free to put more up. We'll see how many we can get through. So Rebecca, the first one that we had in was whether you think that there are certain areas, and I think the questioner was referring to alcohol, in which fiscal policy inappropriately intrudes on personal freedom and agency.
So in the context of alcohol taxation, I think as we outlined, that there are pretty clear rationales for pretty clear evidence that there are large external costs associated with consuming alcohol. And insofar as these are costs which are imposed on other people rather than yourself, then I think it seems like there is a clear role for government in helping to avert those costs which are being imposed on other people. Insofar as their kind of constraints on human agency, I think one of the merits of kind of corrective taxation is that it doesn't remove the option to, say, buy alcohol, but helps to align the decisions that individuals make with the decisions they would make if they bore the costs of their decisions themselves. So it doesn't remove the option. It's not like, say, banning alcohol consumption, rather to help them to make the decisions they would make if they bore all the costs themselves.
Great, thank you. Another question that we had was whether there has been any similar work on the effectiveness of other corrective taxes, such as the sugar tax.
Yeah, so there's been a huge amount of work looking at the effectiveness of different types of soft drinks worldwide. So actually, myself and some colleagues at the IFS have done kind of a piece of work examining and comparing lots of the different research. So looking at these taxes, we see that actually largely they've been quite effective, with corrective taxes being kind of on soft drinks being introduced in many different countries across the world. So largely these taxes do lead to price increases in these products and do alter the amount that people are buying. In the UK, we have a particularly interestingly designed tax on soft drinks as well. Our tax has different bands, with really sugary drinks being taxed at a kind of higher rate than less sugary drinks. And this provides an additional incentive for soft drinks to be reformulated too. So that was kind of one of the key aims of the soft drinks tax when it was introduced, which was to reduce the sugar content of these products while still leaving them on the market for people to enjoy. And this has the effect that insofar as producers have a desire to avoid the tax, they can reduce their sugar content and make them healthier for the people consuming them. And there's suggestive and anecdotal evidence that that's happened in the UK too.
Great, and also on sugar tax, so someone's asked, what are your views on hypothecating taxes? So for instance, the soft drinks levy has been sort of directed towards spending on PE for schools.
So I think I can see the political appeal of hypothecating a tax, insofar as it's probably easier to say we're doing this tax because we think there's a harmful behaviour associated with it, and we're going to then channel that towards solving the problem. From an actually economics perspective, the rationale isn't really clear at all, insofar as we tend to think that you should raise your tax revenue as efficiently as possible and then spend it optimally. Insofar as you link one revenue stream to another expenditure stream, this kind of constrains the amount you can spend based on the amount that you raise. And insofar as, say, a corrective, so I guess insofar as you think that the soft drinks tax were to be really effective and were to lead to actually people consuming minimal soft drinks, then the tax revenue would shoot absolutely to zero insofar as people weren't buying these drinks. But that wouldn't mean that we would necessarily want to spend no money on kind of PE lessons in school. So that's kind of just one example of why you might not want to tie a particular revenue stream to a particular type of expenditure.
Great. So I thought just one last question to kind of wrap up. We've talked a lot about taxes on things that people eat and drink, but I wondered how we can use these insights to think about dealing with the problems posed by climate change, and what lessons should we take from this?
Well, so I think one of the key things that today's lecture highlighted was the importance of trying to tackle the cause as directly as possible. So insofar as, for example, we looked at the design of taxes in alcohol, where often you have, say, just alcoholic products taxed, when in fact you want to tax the alcohol within it. That kind of highlights the value of targeting specifically actually the things which are generating climate change. So I'm not going to claim to be a scientist and properly to understand all the mechanisms, but I think that draws out at least one really key lesson there. Also, I think in the context of climate change, it's going to be important to have a coordinated global approach, because this isn't really a policy area which any one country can solve on their own, but that's going to also be a big challenge going forward.
Fantastic, thank you very much. So we're basically out of time, but I want to just finish by thanking Rebecca for an excellent presentation, and to thank you all for listening and participating. So just to note that if you're interested in finding out more about the work of IFS, you can go to our website. We have our recruitment for full-time positions next year has closed, but we are still recruiting for summer interns. So if that's something that you think you would be interested in, then you can find out more on our website. So yes, thank you very much for coming, and have a great weekend.